Chapter 6. Oral and Written Communications. The office assistant must have sufficient knowledge of medical terminology to deal efficiently with the unending variety of telephone calls received daily. A pleasant voice and good listening skills are essential. Practicing patience and demonstrating compassion to those in need of such attention are important. The medical assistant needs to have legible handwriting for recording appointments and messages. Typing or keyboarding skills are necessary if appointments are to be made on a computer. The student who enjoys keyboarding or working on a computer has an opportunity to develop this skill as an administrative medical assistant. You will have an opportunity to demonstrate your knowledge of anatomy, medical terminology, spelling, grammar, and punctuation as you complete progress notes on charts. You will use these skills also in the completion of correspondence. You may have the responsibility of processing incoming and outgoing mail. Written communication skills must be as flawless as possible. Several people may view the letters or forms you send out, and each will receive a mental picture of you in your office. Good if the work is neat and correct, and definitely questionable if it is inaccurate or messy. Telephone communications objectives. Upon completion of the unit, meet the following terminal performance objectives by verifying knowledge of the facts and principles presented through oral and written communication at a level deemed competent, and demonstrate the specific behaviors as identified in the terminal performance objectives of the procedures. Observing safety precautions in accordance with healthcare standards. 1. Organized desk space for efficient use of the telephone. Answer. Organize desk space for efficient use of the telephone by keeping a message pad and pen next to the phone, placing frequently called numbers and extension lists within view, keeping the appointment book and patient files nearby, clearing clutter from the area, and ensuring the headset or handset is easily reached. 2. Demonstrate a professional method of holding and answering the phone. Answer. Demonstrate a professional method of holding and answering the phone by lifting the receiver or headset before the third ring, holding it 1 to 2 inches from the mouth, speaking clearly, identifying the office and yourself, and using a pleasant tone such as, "Good morning, Dr. Smith's office. This is Jonathan speaking. How may I help you?" 3. Describe methods of screening incoming calls. Answer. Methods of screening incoming calls are asking the caller's name and reason for calling, determining urgency, placing non-urgent calls on hold or taking messages, transferring emergency calls directly to the physician, and following office policy for confidentiality when releasing information. 4. Locate information in a telephone directory. Answer. Locate information in a telephone directory by using the alphabetical listings for names and businesses, checking the yellow pages for services by category, using the government pages for agencies, and using the index or guide pages at the front for area codes and special numbers. 5. Demonstrate a procedure for referring a patient to another health facility. Answer. Demonstrate a procedure for referring a patient to another health facility by obtaining the physician's order, verifying the patient's information and insurance coverage, contacting the receiving facility to confirm ability to accept the patient, scheduling the appointment, providing the patient with directions and instructions, sending pertinent records with proper release, and documenting the referral in the patient's chart. 6. Spell and define, using the glossary at the back of the text, all the words to know in this unit. Answer. All the words to know in this unit are spelled and defined below. Words to know. Colleague. Definition. A person with whom one works in a profession or business. Confirmed. Definition. Established as true or certain, firmly settled. Empathy. Definition. The ability to understand and share the feelings of another person. Etiquette. Definition. The customary code of polite behavior in society or among members of a profession. Expressed. Definition. Stated clearly and openly. Personality. Definition. The combination of characteristics or qualities that form a person's distinctive character. Pertinent. Definition. Relevant or applicable to a particular matter. Rely. Definition. To depend on with full trust or confidence. Screening. Definition. The process of evaluating or investigating to determine suitability or condition. Verity. Definition. A true principle or belief, especially one of fundamental importance. Answering the telephone. The telephone is the center of all activity in the medical office, just as it is with any business. The professional attitude conveyed is critical to the success of the business of practicing medicine. The medical assistant who handles phone calls must be courteous, articulate, and a careful and active listener. The rapport established by the assistant will contribute to successful communication with patients. Most medical facilities have telephones with 2 or more phone lines. This means that someone should answer each line as soon as possible, or at least by the 3rd ring. It seems that on some days all lines ring continually, and there is no let-up. Because of this situation, an automatic answering device is available that will come on with a recording that asks the caller to please hold and explains that the call will be taken as soon as possible in order of the calls. The responsibility of responding to calls takes a great deal of maturity and patience. Knowing what to ask and when to ask it in order to determine how serious a situation or condition is a skill that one develops over time. Telephone triage. An established phone triage manual should be kept near the phone for reference so that each assistant who answers the phone will ask the same standard questions and give the same advice which the physician has pre-authorized. The assistant must learn how to logically proceed through a set of questions that will reveal the caller's condition and help to determine, if necessary, how soon the patient should be seen by a physician. This process is by telephone triage. The assistant must stay alert and ask questions of coworkers and supervisors as they come up to learn how to best deal with problems. If the assistant does not know how to handle a patient, or if the questions have not been addressed in the manual, referring the problem to someone who is more experienced is necessary and appropriate. Never guess in response to a patient's questions, and do not treat any question lightly. If there is a serious telephone emergency that cannot be handled in the facility, it is best to refer the patient to an emergency medical service. Give the phone number to the person if they do not know it, and explain that they will send someone as soon as possible to help. It may be best to direct the person to the emergency room of the nearest hospital. It is a sensible practice to have all emergency phone numbers listed by each phone in the office. In stressful times, this will be helpful in giving the patient phone numbers they might need quickly, or in calling an emergency service for the patient. If you are speaking to a patient face-to-face at the office and you must answer the phone, say to the patient, "Excuse me for a moment, please." Answer the phone call, and then continue with what you were doing. Every emergency call must be handled immediately. Non-emergency calls. If the person on the phone needs additional information, or if the call is going to take a while, excuse yourself from the phone call by saying, "Would you mind being put on hold for a moment?" However, if it will be more than 1 minute, the caller should not be put on hold. In this case, say, "May I call you back with that information?" and find out when a good time is to call back. There may be times when the patient has to wait to speak to the physician. In this case, you should check back every minute until the doctor answers to let the patient know that he or she has not been forgotten. During the time the caller waits, many medical facilities provide the caller with a pleasant recording with reminders of immunization updates, the services and procedures offered by the staff, when routine office hours are, what to do and who to call in an emergency, and other relevant information. This gives the person who is waiting helpful information while the time passes. The assistant must beware of leaving callers on hold for too long. You can be sure that callers will let you know how long they had to wait and how many times they heard the entire recording. If you need to transfer a patient's call to another department or office, first give the caller the phone number, extension number, and the person's name you are transferring them to in case there is a disconnection. You should signal the person or page them, and when they answer, explain who is waiting to speak to them and give a summary of what it is regarding. You may say, for example, "Excuse me, Miss Winters. Mr. Robert James is on line 3 with a question about his insurance." Miss Winters should respond with, "Yes, I can talk to him." You should then say, "Thank you, I'll transfer him now." "Go ahead, please, Mr. James." Then listen to make sure the call was transferred before you hang up. All of this needs to be done quickly and efficiently with a pleasant tone and a polite attitude. This process is much more polite and acceptable than yelling across the room or down the hall for another member of the staff to pick up the phone to speak to someone, or worse, asking the caller to hold while you find the person requested, regardless of whether the person is a patient or not. When a patient is calling for information, remember to pull the file and have it ready for the physician, along with any test lab reports that may be the reason for the call. If you have a public address system where everyone can hear the page, be very careful with confidentiality and merely say, "Dr. Smith, you have a call on line 2. You may have to repeat the page if the call is not answered within 1 minute. Make sure you tell the caller that the person they wish to speak with has been paged. and will be with them as soon as possible. If there is no way to announce a call over a loudspeaker, simply use a small note to confidentially let the doctor know who is waiting to speak to him or her on the phone and which line the patient is on. There may be times when the physician is close to the phone. Simply ask the doctor to take the call and tell him or her who is calling and what the call is regarding. Remember to say please, thank you, excuse me, and so on when appropriate. Establishing good communication, especially over the phone, is essential to building a good rapport. It is important to make a list or a log of all phone calls and note who the person is that you should call back. You should also ask when it is best for a return call. Repeat the number to ensure that you wrote the correct number down and follow through with their request as close to the time as possible. This considerate practice should almost eliminate the frustration of playing phone tag, which is repeatedly calling back and forth and never getting to speak to the intended party. Documenting telephone messages. Documenting telephone messages is of vital importance and should be treated likewise. Of primary concern is the issue of confidentiality. Data regarding patients may not be given out over the telephone to anyone unless the patient has given written permission for the release of specific information with his or her signature. It is equally important that the date, time, a brief message regarding the call, and the initials of the person who responded to the call be recorded. Then, any questions concerning a call may be further explained by the person whose initials are on the message. All calls, regardless of what you may think about their importance, should be documented in the same manner. All messages that are urgent should be given priority and handled as soon as possible to prevent further discomfort, pain, and anxiety for patients. There are commercial answering services available that provide physicians with a practical way to handle all calls during lunch breaks, evenings, weekends, vacations, and any other time necessary. This can be a convenient service for the physician and office staff. There seems to be a greater acceptance of this type of answering assistance because the caller gets to speak to a live person instead of listening to a recording. In an emergency situation, people are more easily comforted by another human voice, even if the doctor is not available. However, problems can arise with these systems because the business employing the service is unable to know all of the people who answer the phone lines. There is the risk that someone who is not adequately trained may be too abrupt or possibly rude to a patient. Yet keeping the human element integrated within professional boundaries is the most desirable way to build rapport when communicating with patients. Voicemail, pagers, and other answering service devices make communications much more accessible than ever before. Answering machines are especially good to use for short time blocks such as during lunchtime. If the standard in your medical office is an answering machine that records messages whenever the physician is not in the office, it should tell the caller how to contact the physician or how to leave a message. This must be done day and night, 365 days a year. Messages need to be played back and recorded as soon as possible. Then, all of the calls need to be returned in the order of their importance within an appropriate and reasonable time period. Some physicians prefer to have patients call them at their home, while others employ an answering service to screen calls and take only urgent cases at home. In this instance, the one who screens the calls will contact the doctor at home, or wherever, usually by pager, and have the doctor return the patient's call. A telephone message pad and pen should be placed by each office telephone. You cannot rely on memory in a busy office where there are constant interruptions. Individual offices have a variety of methods for recording telephone messages. You may use a pre-printed duplicate message pad. The top sheet is removed, and the carbon remains as a permanent record of calls received. The office may use a secretarial notebook that is dated each day. Calls are recorded and checked off when returned. You need to develop a follow-up method to be sure calls have been returned. The call pad or messages should not be filed until the requests have been given a response. Some offices have a stamp made up to indicate in the patient chart a telephone communication and a brief note with the date the patient was contacted. It is not advisable to have loose slips of paper in the file as they are too easily lost. If it is desired to keep these in the chart, they should be filed shingle fashion on a sheet of bond paper with the latest call on top. The slips should be fastened with a piece of transparent tape horizontally across the top of the slip. A vertical piece of tape along the side allows curling of the edges of the slip, resulting in a messy record that is difficult to read. Self-stick telephone message forms help establish effective control of patient calls. One form comes in a single loose leaf style with a stub, like that of a checkbook or loan payment book, which remains in a binder for future reference. Another style has a duplicate copy that remains in a spiral binder and provides a master reference for future review. When a call is received from a patient, the message form is completed. After completing the form, tear it at the perforation and attach the form to the patient's chart by removing the adhesive protection strips at each end on the back of the form. If a patient call requires a return call from the physician, the form is stuck to the front of the patient's chart and given to the physician. When the physician completes the call and records the message, the form is simply removed from the front of the chart and restuck on the inside of the chart for future reference, Figure 6.1. Another telephone message form is a log sheet and a message slip with carbon. The benefits of this system are that you do not have to rewrite the message in the patient's chart, use a telephone stamp, or be concerned about loose slips of paper falling out of the chart. The carbon copy is a permanent record of calls for reference. Examples of telephone message forms are shown in Figures 6.1 and 6.2. The important items of a telephone message are caller's full name, spelled correctly, brief note indicating the nature of the call, action required, date, time of call, initials of person receiving call, phone number of caller. Include the area code if this is a long-distance call. If the telephone has a speakerphone or a headset, your hands will be free to use a pen to write a message, or use the keyboard to log in the patient's call, retrieve the patient's file, or schedule an appointment. Figure 6.3 shows the medical assistant using the headset in a phone conversation. The proper position of a phone with a receiver is shown in Figure 6.4. When you hold the receiver of the telephone, it should be 2 to 3 inches in front of your mouth, so the caller may clearly hear your voice. Many professional offices have cordless phones, speakerphones, or phones with long cords on the receiver for ease in accessing files as needed. The hold, relief button, transfer extension dialing, conference calling, and other features may vary from office to office. You should be honest about your knowledge and experience with phone systems. Ask for a feature explanation and demonstration if you do not know how to use it. Use proper technique with a telephone system, or the caller may be rudely interrupted or accidentally disconnected during a call. Always answer as promptly as possible in a professional manner, because you never know who is on the other end, especially during emergencies. The following example highlights a polite and efficient manner to answer a call. Good morning, Central Medical Center. Ellen speaking. How may I help you? The caller usually gives their name and explains the reason for the call after greeting you. Respond in a pleasant tone and get the patient's complete name and phone number in case of call interruption. This helps if the call is an emergency and gets cut off. If the patient's information is unclear, ask, "Could you please repeat that for me?" Or, "Would you spell your name for me again, please?" It's better to ask for repetition than redo the entire conversation, which might make the patient wonder if you paid attention. Convey confidence rather than insecurity during the call. If you cannot hear someone because their voice is too soft, ask them to speak louder. If they talk too loudly, ask if they could speak softer, faster, or slower, depending on how their voice sounds. Ask patients each time you speak to them about changes to keep files current. When finishing a call, allow the caller to hang up first to avoid missing something important. It is unprofessional to say bye-bye. Instead, say goodbye. If you have multiple lines, do not answer the second line with, "Hold the line, please," while still on the first call. Place the first call on hold, check who is on the second line, and determine whether it is an emergency. If not urgent, ask the second caller to hold and finish the first call. Make all calls as brief as possible and minimize personal calls. Your voice is a key part of your personality over the phone, so it should be confident, courteous, friendly, and efficient. The telephone call is often the first contact a patient has with your office, making your manner and empathy crucial to success. Common types of phone calls. The process of screening calls requires you to be aware of the most frequent types of phone calls that will be received in the medical office. They are referrals, patients who are calling for appointments, prescriptions, or the results of tests. Emergency calls, other physicians, hospitals, or laboratories. Personal calls, and general business calls. A workbook and cassette titled Handling Patients, Telephone Calls Effectively, used in the Department of Practice Management as a guideline for workshops on this important aspect of the management of a medical office, is available from the American Medical Association. Appointments, prescriptions, and test results. Patients who phone for appointments should be given a choice of 2 appointment times. Usually one of the times will be satisfactory, which will eliminate the patient asking for multiple dates and times that are not available. Do not say, "When would you like to come in?" It is better to say, "Do you prefer mornings or afternoons?" Do not say, "Are you a patient here?" It is better to say, When did we last see you? Do not say, "What's the problem?" It is better to say, "Can you tell me what seems to be the problem?" so that we can schedule you properly. The appointment should be confirmed by reading the scheduled time back to the patient after it has been recorded in the appointment book. You will find that patients will frequently ask to speak with the physician. Never say, "The doctor is busy," as this may give the impression that the doctor does not want to be bothered by the caller. Be aware of the statements you make in reporting why the physician cannot speak on the telephone. It would be much better to state, "The doctor is with a patient now. May I take a message and we will return the call as soon as possible?" The caller will usually respect the right of others to have the full attention of the physician and will not expect to interrupt the doctor except for an emergency. Prescriptions. Each office will have its own rules for giving information to patients regarding tests or for calling pharmacies for prescription refills. You must learn the rules for the office you work in and follow them without exception. The general rule is that a medical assistant does not give out information or call in a prescription without the express direction of the physician. Write messages requesting prescriptions or test results in legible handwriting. If a patient requests a prescription refill, you need to know the name and phone number of the pharmacy, as well as the name of the medication, strength, and prescription number. You also should record a telephone number where the patient can be reached, in case the physician needs to talk with the patient before prescribing the medication. The physician may need to examine the patient first, and you would need to call and schedule an appointment. Professional calls. When a physician telephones to speak to your employer, politely ask the caller for his or her name and inform the physician. Professional etiquette dictates that a physician will not keep a colleague waiting unless the physician is involved with an emergency or a surgical procedure. Any calls that come into your office for the purpose of giving X-ray or laboratory results need to be recorded accurately. Always record the name of the person making the report. It is best to read back everything you have written down to be sure it is correct and complete before allowing the caller to leave the line. The physician should review and initial all reports the day they arrive at the office. Pull the patient chart and attach the report. Never file a report that the physician has not seen and initialed. The patient or referring physician may need to be notified of the results by your physician employer. After this is completed, the report will be ready to file. Some physicians also dictate reports, which you will be required to transcribe and mail. Always be sure to make a copy of any correspondence mailed out, so you have a copy to file in the patient's chart. This is always filed with the most recent correspondence on top when the folder is opened. When a patient calls for test results, you should never give them without receiving the physician's instructions on what to report. You would never give information to other people about a patient without the written permission of the patient and the approval of the physician. Procedures 6.1 through 6-4. Outline the steps of answering the office phone. Procedure 6.1. Answer the office phone. Purpose: answer the office telephone promptly and efficiently in a professional manner. Equipment and supplies: telephone, paper, pen, computer, if available. Terminal performance objective: in a simulated or actual situation, using proper grammar, answer the telephone by the third ring, identifying the office and yourself. Answer the phone promptly by the third ring, politely and pleasantly. Identify the office and yourself by name. Note: your voice must be clear and distinct. Speak at a moderate rate, expressing consideration for the needs of the caller. Listen to and record the name of the caller, the reason for the call, and the date and time of the call. Note: obtain the correct spelling of the name. Process emergency calls immediately. Before placing a caller on hold, wait for a response. If you must place the caller on hold, check each minute to let him know you remember he is waiting. A patient should never wait longer than 3 minutes. Complete all calls that were interrupted and/or were placed on hold. Screen and complete as many calls as possible before adding names to the physician's callback list. Respond to an untimely request to speak to the physician by taking a message for the physician to return the call or having advice relayed by you. Business and personal calls. Your employer should let you know how to handle calls from family members, business associates, and salespeople. Calls from attorneys requesting information about a patient must be handled with great caution. Attorneys know the patient must give written permission to divulge information to anyone regarding their health. Yet attorneys will call and ask for information. Pull the patient's chart and look for authorization listing the name of the attorney and the signature of the patient. If you find it, you may answer questions about the patient. If you do not find authorization listing the name of the attorney, you must tell the caller to send an authorization signed by the patient, and then you will be able to release the information. It is advisable to return a call from an attorney, even if you have authorization, so you can be sure who you are talking to. Anyone can call and claim to be a patient's attorney. Unless you know the caller, you cannot be sure you are talking to the correct individual. Only information that has been authorized by the patient in writing, with the patient's signature, may be given to another party. Otherwise, the patient record is considered confidential information. Angry calls. You may receive calls from patients regarding their statement or their insurance. If you are very careful in your accounting and billing, these should be infrequent calls. If you do receive a call from a patient who is angry, be sure you listen attentively. Then tell the patient, "Please hold so I can get your record." If you have made an error, be sure you admit it, apologize, and offer to send a revised statement. Never raise your voice or allow yourself to blame someone else for a mistake you have made. Sometimes it is best to say you will check the records and call back. Always keep your word and follow up with the promised action. Patients will soon learn to trust you if you gain a reputation for careful follow-up of promises. Frequently, patients need to know if insurance has paid the bill or how much was paid by insurance. You can quickly check the record and answer the questions. Reports from patients. When the physician routinely tells patients, "Call me and let me know how you are getting along," you can expect to receive calls to report how the patient is feeling or to report reactions to medications. These reports should be carefully recorded and given to the physician. You need to determine whether or not the physician is expected to respond to the call. Physician visits outside the office. When a patient calls and requests a house call, be sure you check with your physician employer before you schedule one. If your employer makes house calls, you should have a city map or a county map to help locate any new patient scheduled. Many physicians visit patients in hospitals and nursing homes on a regular basis. You need to establish a method of recording these visits and hospital calls. The physician should have a list of calls to be made each day, along with a checklist of needed follow-up and charges for services. Long-distance calls. You may need to place long-distance calls. If you are calling an area outside your time zone, consult the telephone directory for the map of time zones in Figure 6-5 to determine the appropriate time to call. Take into consideration when it is lunch break in a different time zone, so that you will not waste time trying to phone an office when the staff is not available to take your call. Be sure you know the code number needed to dial for your long-distance service. In addition to the telephone numbers of the persons you need to call, a record book should be kept of all long-distance calls made. Call monitoring. When your employer asks you to monitor a call either by an extension phone or speakerphone, listen quietly and take notes of the conversation. It is important to make certain the caller agrees to your listening and taking notes. It is illegal for you to do this without the consent of the caller. Another type of monitoring is to record the phone call, so that it may be played back if necessary at a later time. This is also illegal to do without the party's written consent. Refusal and/or inability to identify. Your office may have a specific method of handling individuals who call and refuse to identify themselves. A good general rule is to suggest that the individual write a letter to the physician and mark it personal, in which case the physician will receive it unopened. Most physicians do not wish to talk to unidentified callers during busy office hours. The rules for handling the physician's telephone can be summarized as follows. 1. Answer the telephone as promptly as possible. 2. Keep a pad and pen next to the telephone at all times. 3. Verify the caller's name and correct spelling. If an adult calls about a child, make sure you have the correct last name. Do not assume the child's last name is the same as the caller's name. 4. Determine the reason for the call. 5. Handle as many telephone calls as you possibly can without disturbing the physician. 6. If the physician prefers to speak to patients, notify the physician by telephone after asking who is calling. Pull the patient's chart and give it to the physician. 7. Whenever possible, if you cannot handle the call alone, take a message for the physician. The physician will tell what to do or call the patient back as time allows. Figure 6-6. 8. Make a memorandum for the physician of every telephone call. Use printed telephone memorandum pads that show date of call, time of call, name of caller, telephone number, and if 9. Always know where to reach the physician, and if the message is urgent and the physician is not in the office, telephone at once and relay the message. 10. If the physician cannot be reached, have the message sent to your phone. When your employer checks in, you may relay the message. 11. Learn how much medical information the physician wishes you to give over the telephone. Patients frequently call the office because they have forgotten the physician's instructions about treatments or medications. These instructions are clearly stated in the chart or in a pre-approved triage manual. It may be possible for the assistant to repeat them to the patient. 12. When answering a second line, determine if it is an emergency or another physician before placing the caller on hold and returning to finish the first call. 13. End all telephone conversations on a friendly note. In general, let the caller be the first one to hang up or say goodbye. 14. Never promise a cure over the telephone or in person. Never say I am sure the physician can help you. If you have answered the phone and no one answers you back after trying twice to converse with them, simply hang up. Some phone systems may have caller ID, which may help in this type of situation. Immediately returning the call in this case may link you to a person in distress. However, it could be a prank call or possibly an obscene call which should be ignored. Of course, if it persists, it should be reported to the police and to the phone company. Many times, the phone directory has a section that outlines the steps that should be taken in situations such as harassing phone calls. Simply telling the caller that you have reported the problem may be enough to make it stop. Taking action as soon as the situation begins is the most sensible course to take. Caution. Never tell anyone over the phone or in person that you are alone, even if you are, as this could be an invitation for undesirable behaviors. For your safety, it is not wise to work alone when there is no one near for assistance. If you must, and only if you must complete your responsibilities, a neighboring office staff member or someone you trust should be informed of your being alone. Procedure 6.2. Process phone message. Purpose: process a phone message properly. Equipment and supplies: telephone, pen, paper, phone, message log or computer, calendar, timepiece. Terminal performance objective: in a simulated situation or actual situation, receive, evaluate, and document a phone message. Answer the phone properly. Refer to steps in Procedure 6.1. 2. Listen carefully to the caller and determine the caller's needs. Refer to Triage Manual, page 136. Note: scheduling a routine appointment may be all that is necessary. 3. Document information regarding the message, including date and time of call, on a message pad or phone call log. You must remember to include who the request is for, what it is concerning, when the information is needed, where to return the call. 4. Repeat the message to the caller to verify the contents. Rationale: this practice helps to avoid errors. 5. End the conversation with the caller politely. Note: it is a good practice to allow the caller to hang up first. 6. Sign your initials after the message. 7. Pull the patient's chart and attach the message. Finding phone numbers. You can save a great deal of time by keeping an up-to-date index of your most frequently called numbers by telephone. In addition, when you need to use the telephone directory, it is helpful to know how it is organized. The introductory section usually contains emergency numbers, community service numbers, general telephone information, directory, assistance information, rates for telephone calls, out-of-city, area codes and time zones, money-saving tips on the use of the telephone, directions for making international calls, rights and responsibilities, directory listings. You will find an alphabetical listing of individuals in the white pages. There may be a separate listing of business and professional organizations in a second section of the white pages. An index of city, county, state, and United States government offices may be found in a separate section of pages. Local zip code numbers by street address are usually in the introduction or a separate section of the telephone book. This section can be taken out of the large phone book and kept on top of the desk in a stand-up organizer for easy access. This makes your job less taxing and eliminates the need to lift a heavy book many times each day. There are also books of complete listings of all zip codes in the country available. This is a necessary reference to have in the office as it saves you from making frequent calls to the post office for information. Within the Rights and Responsibilities section of a telephone directory, you will find very helpful information regarding phone service and safety. The Contents section should be reviewed with each new updated directory, as it will contain information that may have changed from the last edition. Another feature that most telephone companies now have is specialized services and equipment for the deaf. You may have an opportunity to pass this information on to patients who may need these services and are not aware of them. The Yellow Pages, or Classified Directory, list the name, address, and phone number of every business subscriber, grouped under product and service headings. The classified directory also contains an index that can help you determine the headings under which a specific type of product or service may be listed. Complete Chapter 6, Unit 1. In the workbook, to help you meet the objectives at the beginning of this unit, and therefore achieve competency in this subject matter. Unit 2. Schedule appointments. Objectives. Upon completion of the unit, meet the following terminal performance objectives by verifying knowledge of the facts and principles presented through oral and written communication at a level deemed competent, and demonstrate the specific behaviors as identified in the terminal performance objectives of the procedures. Observing safety precautions in accordance with healthcare standards. 1. List and discuss ways that an office staff can establish the most desirable method of scheduling for their individual needs. Answer. Ways that an office staff can establish the most desirable method of scheduling for their individual needs are to analyze patient flow and peak times, review physician preferences and procedure times, consider staff availability, evaluate the type of practice and patient population, and test a chosen method for efficiency before fully adopting it. 2. Discuss what is meant by establishing a matrix and explain why it is important. Answer. Establishing a matrix means blocking out times in the appointment book that are not available for patient appointments, such as lunch, meetings, hospital rounds, or surgery days. It is important because it prevents double booking, reserves time for administrative tasks, ensures the physician's time is used efficiently, and helps staff schedule patients accurately. 3. List and explain the various methods of scheduling. Answer. The various methods of scheduling are open-hour scheduling, where patients are seen in order of arrival. Time-specified scheduling, where each patient is given a set appointment time. Wave scheduling, where several patients are scheduled at the start of each hour and seen in order of arrival. Modified wave scheduling, where wave groups are combined with some time-specified slots. Double booking, where 2 patients are given the same time slot. Clustering or categorization, where similar procedures are grouped. And booking, where appointments are made weeks or months ahead. 4. Discuss the advantages and disadvantages of each method of scheduling. Answer. Advantages and disadvantages of each method of scheduling are as follows. Open-hour scheduling has the advantage of flexibility for patients and the disadvantage of long wait times and unpredictable flow. Time-specified scheduling has the advantage of steady flow and reduced waiting, and the disadvantage of wasted time if patients cancel or do not arrive. Wave scheduling has the advantage of keeping the physician busy, and the disadvantage of possible backlogs if patients arrive at once. Modified wave scheduling has the advantage of balancing flow and reducing gaps, and the disadvantage of complexity for staff. Double booking has the advantage of filling canceled slots and the disadvantage of patient dissatisfaction from long waits. Clustering has the advantage of efficiency for procedures and equipment, and the disadvantage of limiting variety in the day. Booking has the advantage of planning, and the disadvantage of higher no-show rates. 5. List and discuss the most important points to consider in determining appointment scheduling when someone calls the office. Answer. The most important points to consider in determining appointment scheduling when someone calls the office are the reason for the visit, the urgency of the problem, the length of time needed for the appointment, the physician's availability, the patient's preference, insurance or pre-certification requirements, and any special instructions such as fasting or preparation. 6. Discuss the importance of a triage manual for handling telephone calls. Answer. The importance of a triage manual for handling telephone calls is that it gives staff consistent guidelines to assess urgency, provides approved questions to ask, helps decide if the patient needs an immediate appointment, emergency care, or home instructions, protects the office legally, and ensures patient safety. 7. Discuss the most practical way to schedule a patient who is always late. Answer. The most practical way to schedule a patient who is always late is to book them at the end of the day or the end of the morning session. Give them an appointment time earlier than the actual time, or place them in a double-booked slot so the schedule is not disrupted if they do not arrive on time. 8. Explain and discuss the purpose of the rules for handling a canceled appointment. Answer. The purpose of the rules for handling a canceled appointment is to fill the open time slot quickly, reduce lost revenue, maintain efficient patient flow, document the cancellation for medical and legal records, and remind patients of the office policy regarding notice and rescheduling. 9. List and discuss the goals of the physician, the medical assistant, and the patient regarding the appointment schedule. Answer. The goals of the physician regarding the appointment schedule are to use time efficiently, see the maximum number of patients without rushing, and have time for emergencies and paperwork. The goals of the medical assistant are to maintain smooth patient flow, reduce waiting time, keep the physician on schedule, and complete duties accurately. The goals of the patient are to be seen on time, have adequate time with the physician, and experience minimal waiting. 10 list common abbreviations and their meanings used in making appointments. Answer. Common abbreviations and their meanings used in making appointments are NP for new patient, EST for established patient, CPX for complete physical exam, CC for chief complaint, FU for follow-up, CONS for consultation, PE for physical exam, UA for urinalysis, EKG for electrocardiogram, and SOP for second opinion. 11. Discuss various ways of recording appointment schedules and give the advantages and disadvantages of each. Answer. Various ways of recording appointment schedules are the appointment book, computer scheduling software, and daily schedule sheets. The appointment book has the advantage of simplicity and low cost, and the disadvantage of being hard to change and only one person can use it. Computer scheduling software has the advantage of quick changes, multiple user access, and automatic reminders, and the disadvantage of cost and system downtime. Daily schedule sheets have the advantage of portability for staff, and the disadvantage of needing constant updates and risk of loss. 12. State what information should be included in a procedure manual to help the medical assistant with making referral appointments. Answer. Information that should be included in a procedure manual to help the medical assistant with making referral appointments is a list of specialists and facilities with addresses and phone numbers, insurance pre-certification requirements, steps for obtaining authorization, required forms or records to send, instructions for patient preparation, and documentation procedures. 13. Explain and demonstrate the procedures for making various appointments. Answer. Procedures for making various appointments are to gather patient information, determine the reason for the visit, check the schedule for available time, consider the physician's preference and the time needed, confirm date and time with the patient, record the appointment using correct abbreviations, give the patient instructions for preparation, and document the appointment in the chart or computer. For referrals, also obtain authorization, contact the specialist, and send records. 14. Spell and define, using the glossary in the back of this text, all the words to know in this unit. Answer. All the words to know in this unit are spelled and defined below. Words to know. Angina. Definition. Severe chest pain caused by reduced blood flow to the heart. Myocardial. Definition. Relating to the muscular tissue of the heart. Chemotherapy. Definition. The treatment of disease by the use of chemical substances, especially for cancer. Obliterate. Definition. To destroy completely so that nothing remains. Commonality. Definition. A shared feature or attribute. Pre-certification. Definition. The process of obtaining approval from an insurance company before a service is provided. Criterion. Definition. A principle or standard by which something may be judged or decided. Ramification. Definition. A consequence of an action or decision, often complex or unwelcome. Downtime. Definition. Time during which a system or machine is not operating. Remote. Definition. Located far away or distant in space or time. Flex time. Definition. A system allowing employees to choose their own working hours within limits. Sequentially. Definition. In a sequence or logical order. Gatekeeper. Definition. A person or system that controls access to something, such as a primary care physician who authorizes referrals. Sigmoidoscopy. Definition. An examination of the lower colon using a flexible viewing tube. Geriatrics. Definition. The branch of medicine dealing with the health and care of older people. Unstructured. Definition. Without formal organization or pattern. Guarantor. Definition. A person who agrees to pay a debt if the primary party does not. Utilization. Definition. The action of making practical and effective use of something. Increments. Definition. Regular increases or additions in number, size, or amount. Matrix. Definition. A schedule grid showing times available and unavailable for appointments. Work-in. Definition: to fit an unscheduled patient into the appointment book between existing appointments. Appointment strategies. One of the primary and vital functions in the course of managed care is the scheduling of appointments. Procedure 6-5. Managing time well for the physician and support staff will help keep patient flow at a satisfactory pace and promote a good professional working relationship. This may seem like an ideal situation that is unattainable. However, if there is genuine cooperation among all staff members, the schedule should flow well with some understandable exceptions due to emergencies and other unpredictable situations from time to time. Office hours may be scheduled with appointments made during specific times, or left as an open, unstructured block of time. First, the entire staff must be made aware of the intended schedule of the physicians in the medical facility. An in-service or an orientation, whichever the case may be, is a practical way to inform employees about the schedule and enforce the established guidelines for office hours. An organized routine helps the office staff as well as the patients with intended goals. In addition to providing the public with the routine hours when services are provided in printed form, the information should be posted at the entrance of the medical facility, on appointment cards, and on other printed materials. This information should also be placed in phone directories and wherever may be applicable. This way, everyone will know when the doctor is in and at what time business calls and appointments are taken. More discussion about an office policy manual is provided in Chapter 10. After the office hours have been determined, the appointment schedule must be fashioned to meet the specific goals of the physicians and staff. Figure 6-8 outlines the goals that must continually be considered when scheduling. Several styles of appointment books are available to schedule an entire year or more. A standard type of appointment book contains each day of the year, printed with hours ranging from 8 o'clock a.m. to 5 o'clock p.m. as shown in Figure 6-9. Individual medical facilities can have appointment books custom-made for their needs. Where several physicians' schedules are kept, the computer is the most desirable log of appointments as it eliminates the awkward use of several appointment books. When you use computerized appointment scheduling, you totally replace the paper appointment book. You should certainly have an accounts receivable system well established before converting to appointment scheduling. This feature should not be added if you have a single terminal, but it can be effective if you have several terminals. You also must consider how you would handle downtime when, for whatever reason, the computer is not functional. This is a reality you need to plan for before it takes place, so the office will run as smoothly as possible through the downtime. Downtime in this context refers to the time when the computer is basically not working, and you are unable to enter or obtain information. A computerized appointment system locates the next available time automatically, gives you a record of all appointments already made, allows you to locate a specific date and time, and prints copies of the daily schedule. These printed copies should be filed with the accounting records of the day as a legal document that you could be called on to produce in the event of an IRS audit of the office practice. Some computer systems can be used to print charge slips for the patients as they are seen. It is not recommended to try to add an appointment scheduling procedure to the computer until you have a smooth operation under the handwritten system. Establishing a matrix. The appointment book or computer program schedule must have a fixed matrix, which means that wherever there is a section of a page crossed out or a full page or pages crossed out with an X, such as is shown in Figure 6-10, nothing should be scheduled. In a medical practice schedule, this usually means that in these spaces, services by the physician, S, will not be performed during this time. For instance, nothing should be scheduled between the hours of 8 o'clock a.m. and noon on Thursdays, and nothing should be scheduled before 9 o'clock a.m. and after 4:45 p.m. on Fridays, because the physicians will not be in to see patients. It can also mean simply that no one should be scheduled in this time slot, because it is reserved specifically for urgent conditions and work-ins. All staff members need to be aware of the exact meaning of this practice for consistency in scheduling. An entire day with an X through it means that the doctor is out. An X through the afternoon means that the doctor is out only in the afternoon, and an X from 11 o'clock a.m. to 11:45 a.m. or 2:45 to 3:15 usually means that this time is reserved for catch-up and for work-ins, whichever is needed. It may also be referred to as flex time, and can also be useful for time to return phone calls to patients during the day as necessary. If there is an established lunch time each day from 12 o'clock to 1 o'clock p.m., it should be crossed out also. Toward the end of the scheduled day, from 4:40 to 5 p.m. for instance, time is saved so that there will be room to take work-ins if needed. Whether the physician is away for a medical meeting, on vacation, performing surgery, involved in a community service, or whatever else. As soon as the doctor informs the staff, the entire time that is needed should be blocked out so that no one will be scheduled by mistake during this period. To be practical and efficient, time should be blocked out for the entire year ahead if it is regarding a routine day off, or at least as soon as possible as dates of activities are made known to you by the physician. When scheduling appointments on the computer, it is an efficient and practical habit to make a hard copy of each of the scheduled appointments for the day for pulling patient charts. It is also a good practice to do this the day before, to get ready for the arrival of patients the next morning. It is not good to pull medical records too far in advance as it makes files difficult to find when so many are out without guides. It is not practical to place a guide card in place of every record when pulling them for the daily schedule. As patients come in for appointments, the receptionist can cross through their names as they report in for their appointments and their records are pulled, or as they are taken in to be pre-registered, paired to see the physician. An additional hard copy of the daily schedule can make it easier for all to work from, so that the staff can keep track of patient flow and anticipate the needs of patients. Another practice which may be helpful is to highlight in a color, or several, for specific types of appointments, i.e., yellow is urgent, green is recheck, blue is injection, and so on. A separate schedule or section of the master schedule for those professionals in your facility, physician assistant, medical assistant, insurance secretary, and so on, who take appointments for various services, apart from the physician's appointment schedule, should also be kept. Figure 610 gives an example of a multiple appointment schedule. Patients who only need to be given immunizations, have weight and blood pressure checked, urinalysis rechecks, and so on, do not need to be seen by the doctor unless there is a problem. This should be done to avoid having all patients show up at the same time. In many cases, the assistant, who reports the findings to the physician, is given instructions from the doctor and will then report back to the patient. This can save the physician valuable time that may be spent providing managed care to others. This schedule should also have an established matrix. This is a sensible practice that helps to avoid possibly having to reschedule patients because of unplanned meetings, vacations, lectures, and so on. Clear communication among the entire staff must be ongoing to prevent confusion, mistakes, and misunderstandings. In cases where patients have a set or a standing appointment, rescheduling should be done only when emergencies arise and it is necessary. The process of rescheduling involves calling each scheduled patient and offering an alternative appointment time as close to the original one as possible. This, of course, may crowd an already full schedule for a few days or weeks, depending on the extent of the downtime created by the emergency. Downtime in this context refers to the time when the physician is called away from the routine schedule because of an emergency outside the office, usually with a hospital patient, or a personal emergency. The office staff may proceed with duties such as processing records, filing, inventory, and so on, that can be performed without the physician's presence. Once the matrix has been established, the style of scheduling must be decided. There are several different ways to schedule. The preferred method of scheduling that is adopted for a particular medical practice is up to the physician and the staff. The choice should be determined only after creatively planning and carefully reviewing all of the options. In order for a schedule to run smoothly, many points must be taken into consideration. The medical assistant, receptionist, or telephone secretary must have excellent communication skills, a solid knowledge of the signs and symptoms of diseases and disorders, and an understanding of medical terminology and anatomy to proficiently perform telephone triage and prepare an efficient schedule. Obtaining the most precise assessment of a patient's condition by speaking calmly and empathically to the patient over the phone and actively listening to what is being said is referred to as phone triage. Using this type of assessment technique should result in obtaining accurate information and lead to appropriate and complete care. When patients phone the medical facility with the request to see the doctor, the medical assistant must find out who the caller is, ask for the correct spelling of the caller's name and address, and so on, and determine whether the person has previously seen the doctor. Refer to the procedures in this unit that will help you follow a pattern of order with this detailed task. Patients who either stop at the desk after seeing the doctor or who stop in to make an appointment should be given the same courtesy that patients receive over the phone. Offer the person a choice between 2 dates and times. Allow sufficient time for the person to decide, and then confirm it by repeating it to the person before printing it in the appointment book. Remember to write the phone numbers of the patient in the schedule book next to the name, so that you can call the patient quickly, if necessary, without pulling the chart. and note briefly, using abbreviations, the nature of the office visit. Write the time and date on an appointment card and politely hand it to the patient. If the pegboard system is used to record all patient transactions in the write at once fashion, you may record the next appointment in the space provided on the receipt section of the form. You should call attention to the space where the appointment is on the form when you hand the receipt to the patient. Figure 611 shows an example of the pegboard system form. At this time, you should also provide the patient with any appropriate printed instructions or educational materials regarding the patient's condition, further treatment, or scheduled studies. Keep in mind that all appointment cards or forms that are used for this purpose should have the full name of the physician, complete address, phone number, and type of practice printed clearly on them. If the practice is new or in a new location, it is a convenience to the patient to have a small map or instructions on how to get to the office. If there are other office locations, they should also be listed with complete information. Many appointment cards for professional services state that the patient must give the staff a 24-hour notice if a change in the scheduled appointment must be made. A verbal reminder to patients also helps to reinforce this policy. This can be very helpful in maintaining a smooth schedule. A new patient must provide you with complete information, not only so that you can prepare a chart for the initial appointment, but also in case it becomes necessary to reach the patient before the scheduled appointment. If data is on the computer, the needed information can also be called up immediately. Appointment making suggestions. As you gain experience in listening to patients' complaints over the phone, you will become more keen in assessing problems. Using a pre-approved phone triage manual or a medical office handbook is a wise practice, as it reinforces continuity among staff members. All employees must be instructed to use the same format and ask the same questions every time for every patient who complains of similar symptoms. Following these preset guidelines that have been approved by the physician will help uncover serious conditions and lead to more efficient care of patients. Overlooking any of the questions or leaving out any part of a patient's symptoms is potentially a serious risk to both the patient and the medical practice. Also, you must be careful not to put words in the caller's mouth. Asking precise questions and waiting for a response from the patient is recommended. The medical assistant should not offer to speak for the patient, but tactfully encourage the patient to tell in their own words what the problem seems to be and how long it has been going on. Next, the caller needs to let you know what has been done to relieve the problem, if anything. When writing down the information, be exact in how much and how often regarding medications, home remedies, and other treatments. Never leave out information that the patient tells you, no matter how minor it may seem to you. The information disclosed to you by the patient should provide you with sufficient information necessary to determine how soon the appointment should be made. A sample phone call between the medical assistant and a patient is offered in Figure 612. If your medical facility cannot take new patients, as a courtesy, be prepared to suggest a physician in the area who may be able to take the caller. Ask the physician periodically who may be taking new patients in the area so that you may send them referrals as necessary. This service is a professional courtesy, also in cases where the physician cannot take any more patients because of full capacity. Often a person's doctor is determined by the patient's insurance company or health maintenance organization, HMO, for full coverage of medical services. If the provider is not a member of a patient's medical insurance program, the patient must seek a physician who is for medical care expenses to be covered. All information must be determined before the appointment is made. This procedure is called pre-certification. This pre-cert must be done before certain procedures and treatments are performed to confirm that these services are, in fact, approved for guaranteed coverage, and to determine what the percentage is. If a person has no medical insurance and wants to see the physician, the patient must understand that all expenses incurred must be paid for in cash at the time of service, or agree in writing as to the method of payment. If a patient is receiving government assistance for medical treatment, this also must be documented. All staff members must be willing to work cooperatively and efficiently in order to provide quality care to patients. Included in the many choices for scheduling appointments are the following methods: clustering, double booking, open hours, single booking, streaming, wave, and modified wave. Figure 613 lists these methods of scheduling with a description of the purpose of each. Any one of these methods can be used exclusively by itself, or in combination with one or more to fit the specific individual needs of the practice. Even when appointment times have been assigned to patients, it is a good policy to have the patient sign in with their name, address, phone number, the time of arrival, if a new patient, and if seeing the doctor for the first time. This way, Current patient information is obtained as well as the order in which the patient should be taken in. It is also a more foolproof method of keeping track of patients so that no one is overlooked. A sign should be posted giving instructions for patients to sign in as they arrive. Periodic checking of waiting patients will help in case a new patient has not signed in and registered with you. It must be stated that leaving the sign-in sheet out for all to read is a risk, as it allows all patients to read everyone's personal information. You know that you would not leave the appointment book open for the general public to read, because it would break the confidentiality of patients. The ideal way to keep this from being a potential problem is to write the information down yourself as patients arrive, or enter it into the computer, keeping the screen from the view of others. This should be discussed by the staff and an agreement made to determine how this is to be handled. Methods of scheduling clustering. This scheduling technique is frequently exercised in specialty practices as well as in the general and family practice office. A cluster or group of patients who have the same complaint, diagnosis, or other commonality are scheduled sequentially every 10 minutes throughout the morning or afternoon, or throughout a particular day of the week. Some specialists, such as pediatricians, prefer to use this method as a routine standard. Many patients can be provided with the necessary preparations, be examined by the physician, and have appointments completed quickly when clustering is used in scheduling. Double booking. Appointment times are given to 2 or more patients for the same time slot in this method of scheduling. Since most people have varying degrees of the concept of and the respect for time, the possibility of all patients entering the reception room at the same time for an appointment is remote. The usual course of events is that one of 3 will arrive at 1:40 to 1:45 p.m., another at 2 o'clock, and the third a little past 2 o'clock. This is precisely the reason that double booking works out so well. For services that take a small amount of time, this is the ideal way to schedule. It is also a great help if there are patients who are no-shows, those who do not come in for appointments with no courtesy call. Open hours. For a very active practice, such as general and family practices, clinic settings, student health centers, and so on, this method of scheduling is usually the most practical. Patients sign in, noting the time they arrive, and they are seen by the doctor in that order. Emergencies and urgent conditions must be given priority attention. However, as this is being completed, there is usually a backup with patient flow. There may be procedures and treatments that are not anticipated when the patient first arrives. After the physician talks with the patient and performs the appropriate exam, further testing or treatment may be necessary. This process utilizes a considerable amount of time. There is no way to regulate the order of the seriousness of patients' problems. Whenever possible, the urgent medical problems are sent to the emergency room of the local hospital, or an emergency medical service is called to provide immediate care. Single booking. This method is used when the appointment for the patient will take a considerable amount of time, as in consultations, counseling, patient education, or other types of therapy. The medical practices that would be more likely to use this method of scheduling are psychiatry, physical or occupational therapy, and other specialty services. Usually, when there is only one patient or family scheduled each hour, the appointment is made for only 45 to 50 minutes of the hour. This allows for the session to wind down comfortably, as well as for the possibility of the session going overtime by a few minutes. It also gives the professional conducting the services a short break in between patient care and to prepare for the next appointment. Streaming. The focus of this method of scheduling is, as the word suggests, to keep a continuous flow of patients coming in through the facility and to avoid having alternating periods of idleness and crowding. Since most standard appointment books have a printed schedule of a 12-hour day in 15-minute increments, appointments are made to accommodate the specific needs of patients. New patients and those needing complete physical examinations, for example, require a long appointment in order to perform all the necessary preparations, examinations, and any diagnostic tests that may result. Specific medical problems, such as a child with an earache, a blood pressure recheck, or a dressing change, will routinely take no more than a maximum of 10 to 15 minutes. In some instances, some of the scheduled appointments that are allowed 15 minutes may in reality take only 5 minutes. This is the reason that scheduling by the streaming method seems to work out well most of the time. Wave. This method of scheduling is used in many large medical clinics, family and general practice, and group practice, because it runs most efficiently in a facility where there are several medical service departments and qualified personnel to provide managed care to patients. Appointments are made during the first 30 minutes of each hour, The number of patients that are scheduled depends on the type of practice and the amount of time needed for services. The remainder of the hour may be used for those patients who phone the same day and need to be checked by the physician. Since many patients are already scheduled in this type of scheduling, the times in the schedule are most likely filled. If there is a cancellation or a patient forgets to come in, the entire schedule is not ruined. Most often, the start is grateful for a little extra time to catch up on other duties. Modified wave. The modified wave method of scheduling is the same as the wave method plus scheduling patients in the last half hour of each hour in 10 and 20-minute intervals, according to the medical problems. For those patients that you know will need the most time with the doctor, the beginning of the hour is the logical choice of time. For patients who will most likely take only a few minutes, the last half hour seems to work best. Scheduling in this manner yields some flexibility, so that patients who have urgent health problems or injuries can be worked in between already scheduled patients. Maintaining the schedule. After a period of time, through trial and error, each medical practice staff member arrives at a schedule that works best for them. An assessment should be made of the efficiency of the schedule, and appropriate changes should be made to better serve expedient patient flow. Management consultants suggest an evaluation of old appointment sheets for a 12 to 15-week period. The number of work-ins, cancellations, and no-shows, and the time spent with specific exams and complaints of patients will help determine the course of the revision of scheduling techniques. The time slots needed for various procedures, exams, and consultations can then be handled in short, medium, long, and extended appointment times. Often, a patient needs to have several procedures performed or must see one or more doctors in an office or a medical center. Coordinating all of these appointments for the patient on the same day is most thoughtful and will save the person from having to repeat unnecessary expense and travel, which can be very tiring, especially to the elderly patient. The medical assistant may be expected to provide an explanation of different medical specialties, medical terms, instructions for procedures, exams, or treatments for patients who are unfamiliar with such matters. Sending the patient printed instructions regarding procedures and exams, along with an appointment card prior to the scheduled appointment, helps patients get prepared and reduces their anxiety. Further discussion and helpful information about diagnostic examinations are provided in chapters 15 and 16. Another thoughtful service to patients is to give simple but precise directions on how to get to your location. A map or printed instructions mailed to the patient before their appointment is appreciated by persons who are not familiar with your geographical area. An office brochure is a way to give new patients a brief explanation of your facility's policies and procedures regarding office hours, location and directions, when to call, who to speak to for administrative business, the procedure for medication refills, and so on, and the philosophy of the practice. This way, all information is in one neat package. Educating the patients in these areas is most helpful in the elimination of repeat calls, asking the same information. Remember that patients who have to wait a long time before being seen by the physician become impatient and eventually angry, especially if the patient had a scheduled appointment. Understandably, this patient may wonder why an appointment was even made. Surveys have shown that patients usually do not mind as much as a half-hour wait, but tend to become angry if it is any longer. This could lead to medical legal ramifications if it is not handled properly. Patients' time is as valuable to them as it is to you and the physician. Delays should be made known to patients tactfully as soon as they are realized. Patients need to be given the choice of waiting for as long as it may be, or rescheduling for another appointment time altogether. This is a considerate way to treat patients and prevents problems from starting. Announcing that there will be a delay as soon as you have been given the information, for instance, that the doctor is caring for a patient with an emergency at the hospital, is something that patients will understand and appreciate. It is far better to be honest with patients and let them know what the situation is from the start than to be silent. Patients appreciate your letting them know so that they can make a choice about waiting or returning at another time. A periodic announcement should be made to those patients who are waiting as to how much longer it may be before the doctor can see them. Handling patients without appointments. There may be a time when a patient who has an appointment brings along a family member or a friend to be seen. This complicates the schedule and presents a challenge in tact and diplomacy to the staff. When a patient arrives who has no appointment in a practice where it is necessary to have an appointment to see the physician, you need to explain this to the person as tactfully and as politely as possible. When the patient realizes that the doctor can spend a sufficient amount of time only with those patients who are scheduled, cooperation is usually attained. Patients who are persistent because of the nature of their problems should be referred to a physician. If a patient walks into your office with no appointment, the person should be referred to an appropriate medical facility, according to the person's symptoms, if there is no way your schedule can accommodate them. The physician should be made aware of the situation before any definitive action is taken. The nature of the patient's problem will determine how quickly you should act. Often, the PhysiClan will make an exception and reinforce the policy for future appointment scheduling. If it is a serious emergency, you should automatically call for emergency medical service. In some cases, the physician may agree to take care of the emergency and then refer the patient to another physician for continuous managed care. If a patient cancels or does not show up for the scheduled appointment, it should be noted in the patient's chart and the appointment time given to another patient as soon as possible. The physician should be notified about the patient's cancellation or no-show. He will advise you about further action as warranted by the patient's condition. For example, if a patient is being treated for a wound that requires follow-up care and a dressing change, the patient may cancel or just not come, and the wound area could become infected. The patient might decide to sue the doctor for inadequate care. The record of the canceled appointment or no-show is important in proving that the patient had an appointment but failed to follow the physician's instructions. The patient's name should be left in the appointment book with a single line drawn through it. It is also wise to phone the patient at home and leave a message with someone or on the recorder if the patient cannot be reached about the missed appointment. If patients cannot be reached by phone, mailing them a letter noting the missed appointment with a request that another appointment be arranged by calling the office. This procedure provides legal protection if a lawsuit is filed against the physician for failure to provide care for the patient. Having this process documented will show concern for the patient. It is difficult to prove negligence when such efforts to offer medical help have been made. You should never erase a name or use liquid paper to obliterate a name in the book. Do not use a pencil. There are those who, even though it is not a suggested practice, use a pencil in their appointment books. If this is the case, the entries should be written over at the end of the day in black ink. Having used a pencil and possibly erasing from time to time during the course of the day may make the appointment book look messy, besides raising questions as to what names were erased and why it was done. Having a patient's name in the schedule book, even though the appointment may not have been kept, will help defend efforts to provide the patient with the opportunity for medical care if ever the need arises. If there is no name on the appointment schedule because it has been erased, it is very difficult to prove that care was offered to the person. Management consultants advise that no alteration of the schedule be done, as it may look as if one was trying to conceal information or fraudulently add it in at a later date. The appointment schedule is an official legal document and must be legible. For a cancellation, place a large letter C at the beginning of the person's name to indicate a cancellation, or C and C to indicate that the patient did call, to tell you the reason the appointment had to be canceled. Some office personnel find it helpful to use a stamp to record in the chart the fact that the patient did not keep the appointment. The date, time, and reason, if known, for the missed appointment would be all that you would need to write, plus your initials. All staff members should be given a copy of the abbreviations common to your facility so that there is consistency with their use and the meanings are clear. A list of some common abbreviations that can be used in the appointment schedule is shown in Figure 614. A more extensive list of abbreviations is in the appendix of this text. For legal concerns, all appointment schedule books must be kept for 3 years. It should be positioned out of the reach and eyesight of other patients and unauthorized persons. In addition to routine scheduled appointments, emergencies, and unexpected disruptions, there are other ancillary health professionals who may stop in to give the physician new information regarding medications, office equipment, medical supplies, and so on. A smart way to deal with this before it becomes a routine disruption is to offer a regular appointment to the salesperson or pharmaceutical representative or detail person. Having a standing appointment, meaning at the same time and occurring regularly, for sales reps will allow the physician to acquire the most current information on products and have any questions answered immediately by the professional salesperson. Many reps bring in a variety of complimentary items on occasion, including lunch and other treats for the office staff. Leaving brochures and sample medications is another common practice of sales reps. You will have to organize and file or store all of the items that are left after the physician sees them. There is no need to schedule an extended amount of time for these individuals. Often the doctor chats briefly in the hallway, and only a portion of the time blocked out for the appointment is actually used. Many physicians prefer not to see these salespeople and ask that they talk to the office manager or medical assistant, or just send information by mail only. If any new items are of particular use to the practice, information and samples may be left for the physician's perusal. If another doctor or a family member stops in to see the physician, you should politely interrupt and let the physician know so that the guest does not have to wait. A reminder to the physician employer that the reception room has X number of patients waiting is a good idea before the meeting ensues. If this practice of surprise visits becomes a habit, it should be addressed in a staff meeting or in a private conference with the physician. The medical assistant should note trouble spots in the schedule and report them to the physician or office manager periodically. This subject can be presented at staff meetings so that, with the sharing of ideas and suggestions, a better schedule may result. If the problem is that patients have had to wait far too long to see the doctor over a period of time, that is more often than not, then it is possible that there are more appointments made than the doctor can see in the set office hours, and the simple remedy is that fewer appointments should be scheduled. It is vital to the success of a schedule that the medical assistant maintain open communication with the physician and staff regarding patient flow. The development of a team feeling should allow staff to be honest, consistent, loyal, considerate, and by all means to avoid gossip. A professional image is reflected through attitude, abilities, appearance, and ethics. When these characteristics are evident in a team spirit, cooperation and success will be obvious. In certain situations where it seems that all efforts to improve scheduling have failed, it is smart to enlist an efficiency expert for an objective viewpoint. One who is not involved daily is better able to observe many points that could be changed for the better. Their expertise can make all staff members more aware of how the schedule affects everyone throughout the office. The ideal schedule should provide a comfortable pace for the staff without making the patients feel rushed or slighted. The importance of building good rapport with patients is invaluable. Scheduling is where it begins, setting and keeping realistic schedules. Since the physician generally expects the medical assistant who schedules appointments to do so in time slots that are realistic for presenting complaints of the patients. A sample guideline for some typical office visits is presented in Figure 6.15. This is just a sample of the amount of time that may be spent with procedures and other services. The actual amount of time spent with patients will depend on the speed of the staff, the patient, and the physician, as well as how talkative all concerned are before, during, and after the service rendered. A good rapport is built with patients when the service is achieved, pleasantries are exchanged, and the time seems to pass quickly. Variations and rearranging of appointments may be necessary according to the way the course of events unfolds during any given day in the medical practice. Experience will be the best teacher in arriving at a successful schedule, helping to maintain the physician's schedule. In addition to scheduling patients appropriately, the medical assistant has the responsibility to help the physician keep on time. If it looks as though the doctor is working faster than usual, calling in patients to be seen earlier to keep the patient flow moving at a steady pace is a sensible idea. On the other hand, if there is an obvious slowing down on the part of the physician or other staff members, and the schedule is getting backed up, the medical assistant should call patients and either delay their arrival time or reschedule them for another day, if the physician agrees that catching up is nearly impossible. Studies have shown that while a 10-hour day is 25% longer than an 8-hour day, the increase in productivity only rises 6% because of the increased likelihood of making errors. Therefore, overworking could prove hazardous to patients as well as to yourself and your coworkers. The medical assistant may also want to work out a signal with the physician for those times when the patient gets too talkative and is taking more time than was allotted for the appointment. A suggestion is to interrupt either by a signal over the speaker, such as, "Excuse me, doctor, you have a call on line 5, and there are only 4 phone lines." You may decide that a simple knock on the door, or a particular signal on his or her pager, can help the physician stay on task and help avoid getting further behind in schedule. Handling late patients. There may be a few patients who seem to be late for every appointment they make. In this situation, you may schedule them just after you come back from lunchtime and just work on the appointment when they arrive. Or you may decide to schedule them at the end of the day. If the person does not arrive for the appointment at the time it was scheduled, a reasonable time of waiting was documented, and attempts were made to reach the patient by phone to determine if he or she was still coming. The patient will find no one at the site and may think twice before being late again. You should predetermine a reasonable amount of time that you will wait for a patient, possibly up to 15 minutes for unexpected and reasonable delays, to avoid problems that could stem from leaving the premises before all patients have been seen, even if the patient is late. Providing printed information regarding office hours as well as posting them will help to avoid such situations from happening. At certain times of the year, there seem to be expected conditions that play havoc with a schedule, such as colds and flu in the winter months, injuries during winter and spring breaks from school, rashes and other ailments related to summer, and so on. These problems must be taken into account when preparing the daily schedule, especially the types of problems specific to the particular practice where you are employed. A pause of a few minutes between patient exams is acceptable. However, if there is too much slack time and more than a few minutes between patients happen too often, scheduling techniques need to be reviewed. Figure 616 offers a list of some helpful points to keep in mind when scheduling appointments. The saying "time is money" is a good thought to consider. It should remind us to use time well and for the purpose intended. Efficient use of the physician's time and the entire staff's as well in treating patients is the main purpose of a schedule. Again, cooperation among the staff is required for a successful outcome. Appointments outside the medical office. When a patient develops a condition or requires an examination that your office cannot take care of, your employer will refer the patient to an appropriate colleague or facility. The office should have a page in the office procedures manual listing the names, addresses, and phone numbers of physicians your employer wishes to refer patients to in the different specialty areas. You should give at least 2 names. Have the name, address, and phone number of facilities where you might refer patients, such as laboratories, X-ray facilities, and community clinics, handy for use. Keep in mind that certain managed care plans require referrals to specialists within the plan with the approval of the primary care physician, known as the gatekeeper. A list of these plans and participating physicians for handy referral is an excellent time saver. When a patient is to be admitted to the hospital, it is important to know what admission information the hospital will require. Be prepared when you call to give the necessary information regarding the patient. Hospitals have established guidelines for admitting patients. The purpose of these guidelines is to cut the cost of hospital care. If the care needed by the patient can be given in an outpatient facility, this must be the method used. Many insurance companies and government-sponsored programs require a pre-admission evaluation of the need for hospitalization of a patient. To determine the need for admission, a criterion statement would need to be composed by the admitting physician, using specific terminology as to the severity of the illness and an assessment of need. Definitions that may be given for these terms are: acute onset, meaning symptoms occurred within the last 6 hours; sudden onset, meaning symptoms occurred within the last 24 hours; recent onset, meaning symptoms occurred within the past week; and recently or newly discovered, meaning symptoms not present on previous examination. In some cases, in addition to terms describing the severity of the illness, the vital signs such as temperature, pulse, respiration, and blood pressure, laboratory workup, any functional impairment, the physical findings, the need for monitoring, the medications needed, and the procedures, along with criteria for discharge, must be considered as part of the determination for the need for admission. In scheduling an admission, you may be asked to identify the attending physician for the admission, the service admitting under such as whether medical, surgical, obstetrical, and so on, the admission date requested, and the type of reservation. The type of reservation might be inpatient, admitting day surgery, ambulatory surgery, or patients who walk in, have surgery, and go home, or outpatient. Some hospitals furnish nearby hotel rooms for chemotherapy patients or other patients who need daily treatment for several hours, but do not need to be admitted to a hospital room. Other information needed is listed here. 1 full name of the patient, including maiden name of married female patient, 2 age and date of birth, 3 sex of patient, 4 marital status, 5 social security number, 6 address including zip code, 7 telephone numbers for the home and work of the patient and the closest relative, 8 primary insurance guarantor and social security number of this individual, 9 employer of guarantor and work telephone number, 10 hospital insurance coverage along with verification if prior authorization was granted, 11 name and address of referring physician, 12 the physician needs to furnish the diagnosis and plan of care for the utilization committee review. 13 if surgery is to be scheduled, you need to give the date of surgery, the expected length of the procedure in hours, the name of the procedure, the type of anesthesia, units of blood needed, and whether X-rays will be taken. 14 when pre-admission testing is to be carried out, you need to know the date, time, and names of tests, X-rays, electrocardiograms, and so on. If a generally required test is not ordered, you need to explain why it was not ordered. The following conditions will generally justify inpatient hospital care for an otherwise outpatient procedure if the severity of the illness or intensity of service needed warrants it: severe myocardial insufficiency with or without angina, chronic congestive heart failure, chronic obstructive lung disease, bronchial asthma, diabetes, thyroid disease, hypertension. Guidelines are generally established with a detailed listing by International Classification of Diseases, 9th revision, clinical modification codes for elective outpatient procedures, for elective procedures that might require a preoperative length of stay, and for those procedures to be done on admission day. It is the medical assistant's responsibility to assist patients with their payments and any necessary follow-up or referral appointments after the physician has seen them. The need for a follow-up appointment may be marked on the charge slip by the physician, or the patient may be told to inform you of this need. The patient should be given the choice of 2 appointment times, and only after the entry is made in the appointment book should an appointment card be prepared and given to the patient. This practice will prevent the possibility of forgetting to enter the patient's name in the book. Physicians who treat patients who need regular follow-up, but do not make appointments for 6 months or a year in advance, may choose to send a recall notice. This notice could be a pre-printed card sent to the patient as a reminder to call or write for an appointment. An example would be a reminder for an annual Pap test. Some offices find it helpful to send a reminder notice of appointments that were made far in advance. You might even ask the patient to address such a card at the time the appointment is made. The patient is handed an appointment card which he or she may lose, and at the same time addresses a card with the appointment time marked on it. You place this in a file under the date when it should be mailed. This practice might be helpful for the forgetful geriatric patient or the busy executive who may forget to put the appointment in the date book along with business appointments. Complete. Chapter 6, Unit 2. In the workbook, to help you meet the objectives at the beginning of this unit and therefore achieve competency in this subject matter. Unit 3. Written Communications. Objectives. Upon completion of the unit, meet the following terminal performance objectives by verifying knowledge of the facts and principles presented through oral and written communication at a level deemed competent, and demonstrate the specific behaviors as identified in the terminal performance objectives of the procedures. Observing safety precautions in accordance with healthcare standards. 1. List 7 types of correspondence medical assistants may need to prepare. Answer. 7 types of correspondence medical assistants may need to prepare are business letters, form letters, memos, appointment reminders, referral letters, collection letters, and patient instruction letters. 2. Name instances when form letters may be indicated. Answer. Instances when form letters may be indicated are routine appointment reminders, recall notices for annual exams, welcome letters to new patients, billing and collection notices, insurance claim follow-up letters, and general patient education mailings. 3. Produce a memo. Answer. To produce a memo, use the heading with to, from, date, and subject lines. State the purpose clearly in the first sentence. Provide details in short paragraphs, and close with any action required. Example. To staff, from office manager, date, May 1st, subject staff meeting. There will be a staff meeting on Friday at 8 o'clock in the conference room to review new scheduling procedures. 4. Demonstrate correct grammar, spelling, punctuation, and sentence structure to compose original letters. Answer. Demonstrate correct grammar, spelling, punctuation, and sentence structure to compose original letters by using complete sentences, subject and verb agreement, correct tense, proper capitalization, commas for clarity, and accurate spelling of medical and business terms, with proofreading before mailing. 5. Name 6 specific criteria for written communications. Answer. 6 specific criteria for written communications are clarity, conciseness, completeness, correctness, courtesy, and neatness. 6. Name and give examples of the 8 parts of speech. Answer. The 8 parts of speech and examples of each are noun, such as patient, pronoun such as she, verb such as schedule, adjective such as urgent, adverb such as quickly, preposition such as with, conjunction such as and interjection such as o. 7. Identify the 9 standards for producing a mailable business letter.
Answer. The 9 standards for producing a mailable business letter are a correct letterhead and date,
A proper inside address, an appropriate salutation, a clear message with correct grammar and spelling, a courteous tone, concise paragraphs, a proper complimentary close, a typed signature line with a handwritten signature, and neat enclosure notation if needed. 8. Explain the characteristics of business letter styles.
Answer. The characteristics of business letter styles are as follows. Block style has all lines
Beginning at the left margin. Modified block style has the date, complimentary close, and signature block beginning at the center. Simplified style has no salutation or complimentary close and uses a subject line in all capitals.
9.
Use the formatting standards to prepare a business letter.
Answer. Use the formatting standards to prepare a business letter by setting 1-inch margins,
using single spacing within paragraphs and double spacing between paragraphs, placing the date 2 to 6 lines below the letterhead, leaving 2 to 4 lines between the date and inside address, using a colon after the salutation, and leaving 4 lines for the handwritten signature above the typed name.
10.
Correct a typewritten copy.
Answer. Correct a typewritten copy by reading the entire document,
marking errors with standard proofreading marks, checking spelling and grammar, verifying names and numbers, ensuring proper format, and retyping or correcting the copy before mailing.
11.
Use standard proofreading marks.
Answer. Use standard proofreading marks such as delete, insert, close up, capitalize, lowercase,
move left, move right, start paragraph, no paragraph, transpose, and set to indicate corrections on a draft. 12. Discuss 11 problem areas in written communications.
Answer. 11 problem areas in written communications are poor grammar, misspelled words,
incorrect punctuation, unclear meaning, wordiness, inappropriate tone, incorrect names or titles, inaccurate information, poor organization, illegible handwriting, and improper format. 13. Spell and define, using the glossary at the back of the text, all the words to know in this unit.
Answer. All the words to know in this unit are spelled and defined below.
Words to know. Adjective.
Definition. A word that describes or modifies a noun or pronoun.
Interjection.
Definition. A word or phrase expressing emotion, often set off by punctuation.
Adverb.
Definition. A word that modifies a verb, adjective, or another adverb.
Mailable.
Definition. Acceptable for sending through the mail.
Apostrophe.
Definition. A punctuation mark used to show possession or to indicate a contraction.
Misspelled.
Definition. Spelled incorrectly.
Clause.
Definition. A group of words containing a subject and a verb.
Modifies.
Definition. Changes or describes the meaning of another word.
Communication.
Definition. The exchange of information or ideas by speaking, writing, or other methods.
Noun.
Definition. A word that names a person, place, thing, or idea.
Compose.
Definition. To write or create.
Postscript.
Definition. A note added after the signature in a letter.
Congratulations.
Definition. An expression of pleasure at another's success or good fortune.
Preposition.
Definition. A word that shows the relationship of a noun or pronoun to another word.
Conjunction.
Definition. A word that connects words, phrases, or clauses.
Pronoun.
Definition. A word used in place of a noun.
Context.
Definition. The parts of a written or spoken statement that surround a word and clarify its meaning.
Proofread.
Definition. To read and mark corrections in written material.
Contraction.
Definition. A shortened form of a word or words with an apostrophe showing omitted letters.
Punctuation.
Definition. Marks used in writing to clarify meaning and separate sentences.
Correspondence.
Definition. Communication by exchange of letters.
Signature.
Definition. A person's name written in their own handwriting.
Critique.
Definition. A detailed analysis and assessment of something.
Stationery.
Definition. Writing paper and envelopes.
Denote.
Definition. To indicate or represent something.
Thesaurus.
Definition.
A book of synonyms and antonyms. Ellipses. Definition: a series of dots indicating an omission of words. Verb.
Definition: a word that expresses action or a state of being.
Galley proofs.
Definition: printed copies of text for correction before final publication.
Watermark.
Definition: a faint design made in paper during manufacture and visible when held to light.
Hyphen.
Definition: a punctuation mark used to join words or to separate syllables.
Written communication. What is communication? Webster defines it as the giving or receiving of information.
A system for sending and receiving messages. You can communicate in many ways, such as talking, gesturing, or writing. Written communication is often called correspondence.
Again, Webster says correspondence is communication by the exchange of letters.
An individual who is hired by a newspaper or magazine to furnish news regularly from a certain place is called a correspondent.
There are schools where you can receive instruction in a particular subject by mail. They are known as correspondence schools.
But in its broader sense, correspondence can be thought of as any exchange of information between persons. With this interpretation, correspondence or written communication could include sending notes, inter-office communications, IOCs, form letters, information sheets, and business, professional, and personal letters. In a physician's office, written communication may be necessary to officially inform the staff of a policy or decision,
to contact professional colleagues, to correspond with professional associations, to request or respond to a medical consultation, and to engage in business communications with medical suppliers, financial consultants, attorneys, and insurance companies, to send personal messages.
Inter-office communication, IOC. This is an informal memo-style communication, usually specific to a single concern.
It is an effective way to ensure that everyone is aware of an event, policy, concern, and so on. If you want to ensure that everyone reads the memo, a copy must be given to each person, or one can be posted or circulated with an attached list of all people involved, who then must enter their initials next to their name to indicate they have read the memo.
An example might look something like Figure 617A and B.
Informal notes. This type of correspondence is also informal in nature, and would be indicated for times when thank yous, congratulations, or similar expressions are desired. Usually these are personal in nature. Often these are written on a first-name basis.
Personal letters.
The physician may ask for assistance with personal correspondence.
It is common for medical assistants to correspond with travel agencies, mail-order catalogs,
perhaps clothing suppliers and specialty shops. A competent medical assistant should be able to compose or write the necessary letter given the specific information desired. So all the physician has to do is sign their signature. Professional letters. Physicians may need to write to their professional associations, licensing boards, and other physicians regarding some issue or concern affecting their personal medical activities or their professional practice. Perhaps your employer holds an office in a medical society that requires communicating with the members or issuing the group's opinion on a particular subject to the community or media. Some physicians hold office on a hospital medical board, which might necessitate issuing written communication. Physicians who participate in research do a great deal of professional correspondence in regard to the experimental studies being conducted. Some physicians enjoy writing professional journal articles about a unique patient, or explaining a procedure they have developed. Obviously, these specific writings require detailed dictation and perfect transcription. Business letters. The greatest amount of correspondence, however, is of the business type required to manage the affairs of the practice. This would include the referrals, consulting, annual examination reminders, collection letters, school and work releases, suppliers of equipment and materials, and other correspondence necessary to the office operation. These types of letters can be individually composed, or a type of form letter. Pre-written form letters can be developed and stored electronically on disks of computers or word processors. When needed, the letter is pulled up. The appropriate date, name, address, amount due, and so on, is added, and it is sent without the need to prepare the total letter. Form letters are especially well suited for and return to work or school approvals, following surgery or illness, annual diagnostic examination reminders, eye examinations, pap tests, mammogram, sigmoidoscopy, delinquent account reminders, usually in about 3 increasing levels of request intensity, office visit verifications for work or school absence, some athletic participation approvals, providing information to referred patients regarding appointment confirmation, office location, information needed, approximate time required for appointment, payment policy, and so on. Several businesses offer prepared medical forms, both in hard copy for completion or as software packages for computer use. If your office is not yet computerized, it is possible to draft the necessary letters on a typewriter, leaving adequate spaces to insert the appropriate information specific for each patient. The master of each form letter is stored in a file and copies to be filled in are made as needed. This method requires a little practice to line up margins and the typing line so that it matches the rest of the letter. Information sheets. Specific written instructions regarding the examinations and diagnostic tests performed in your office are very beneficial to patients. They help to reinforce what you have explained and serve as a reminder after they leave the office. They typically explain to patients how to prepare themselves for a particular test, or what to expect when the test is performed. Usually, there is a place on the form to enter the date and time the examination is scheduled. These information sheets can be prepared and stored in the files to be used as needed. Preparing written communication. Almost every day, when the mail carrier arrives, there is something to be received that requires a response. Your employer may want to review all the mail personally and request that you only open the envelopes and arrange everything neatly on the desk. Some physicians allow the mail to be opened and sorted, referring only to professional or personal material that requires their response. Anything about practice operations is handled by the office manager. After a few days, the physician will need to devote some time to drafting responses to inquiries or responding to referrals. Some may use a dictating machine, while others may prefer to dictate in person. Surgeons and other specialists who have a large number of referral patients will have the greatest number of responses to compose. Usually, a type of form letter is developed with the opening and closing paragraphs being a standard format, and the middle of the letter specific to the patient. This format only requires minimal dictation. After the opening, "Thank you for referring," and the closing, "If I can be of any additional assistance." Of course, occasionally, written communication is required that is specific to a request or concern, so the total correspondence is individualized. Probably the most important criterion about any communication is that it be written using proper grammar and punctuation and have no misspelled words. It also must be spaced on the page properly and be neat and clean. Try not to use the same major word twice in the same or even consecutive sentences. The following information will assist you in producing attractive, error-free communications. Spelling is difficult for some people. If you are one of them, you will have to try exceptionally hard until you master certain rules and habits. Here are some ideas that might help. If you have certain words that you cannot seem to spell correctly, try making a list of them to use as a quick reference. And make a mental picture of the word correctly spelled. Pronounce the word correctly several times. Write the word, dividing it into syllables and inserting accent marks. Write or type the word several times. Learn to use a dictionary when you are in doubt. And if you use a word processor or computer software to compose correspondence, be sure to run your document through the spell checker. It will catch most errors. Unfortunately, you cannot rely on the checker completely because it is possible that the word is spelled correctly, but you have entered the wrong word, a word out of context. Examples of this are using their, cite, for cite, write, for write, your, and several others. There are 14 rules about spelling which are very helpful once you understand how to use them. Refer to Figure 6.18.
Parts of speech. To compose effective, well-written communications, you need to be aware of the 8 parts of speech and how they are used. 1. A noun is the name of anything. It may be a person, a place, an object, an occurrence, a quality, a measure, or a state. Examples of words that may be used as nouns are assistant, laboratory, instruments, office, empathy, manners, kindness, and attention. The assistant draws blood and takes it to the laboratory. The assistant shows kindness, empathy, and attentiveness to all patients in the office. 2. A pronoun is a word that is used as a noun substitute. The most often used pronouns are I, me, she, her, you, he, him, who, which, that, one, all, some, everyone, it, there, they, any, and nobody. 3. A verb is a word, or word group, that expresses action or a state of being. Every sentence must have a verb. Examples of words which may be action verbs are do, write, speak, hesitate, educate, perform, assist, obtain, and attend. Examples of verbs that may express a state of being are am, are, is, will be, have been, feel, seem, and appear. 4. An adjective is a word that describes, limits, or restricts a noun or pronoun. The conscientious medical assistant reports for work on time. She is an energetic, efficient, and dedicated employee. 5. An adverb is a word that modifies a verb form, an adjective, or another adverb. The most common ending for adverbs is lie. Adverbs should be used to answer questions such as how, when, where, how often, to what degree. It is incorrect to say I did really well on the terminology test. You should say I did very well on the terminology test. Examples. Sometimes the assistant reports early to the office and stays late. Usually, when a patient angrily confronts an assistant, the assistant should answer calmly and quietly after the patient has finished talking. 6. A preposition shows the relationship of an object to some other word in the sentence. Prepositions must have an object. If a pronoun is the object of a preposition, it must be in the objective case. Examples. Medical supplies arrive for the doctor, the nurse, and me.
Between you and me, that physician's handwriting is most difficult to read. Some common prepositions include with, without, for, against, above, below, on, under, through, between, by, during, among, concerning, in, from, to, and of. 7. Conjunctions are connectives that join words, phrases, and clauses. Examples are and but or nor, for yet, because, if, and since. 8. An interjection is a word used to express a strong feeling or emotion. Examples are ouch, hooray, well, and oh. These words are usually followed by an exclamation point or a comma. Examples of sentences containing all 8 parts of speech. Yes, a busy medical practice like theirs always employs efficient and energetic medical assistants. Well, a conscientious medical assistant like you will sit confidently for the certification examination and pass it. Oh, that emergency patient canceled after he had rested and settled down. Once you have the spelling and the parts of speech under control, it is time to put the words together in sentences. Written material should be composed of sentences of differing lengths and complexity to appropriately match the type of written matter being prepared. Patient referral or business letters require concise material, while personal correspondence or medical articles can contain more variety. Be careful not to make run-on sentences containing too many clauses. The following information outlines sentence construction. Sentence structure. When writing letters, write in complete thoughts. A simple sentence consists of only one complete thought, that is, one independent clause with a subject and a verb. Examples. Physicians examine patients. Physicians prescribe medication. The receptionist scheduled appointments. A compound sentence contains 2 or more independent clauses. Examples. The physician dictates letters and the medical assistant transcribes them. Administrative medical assistants perform clerical duties and clinical medical assistants perform nursing skills. Laboratory technicians analyze specimens and medical assistants assist with physical examinations. A complex sentence contains one independent clause and 1 or more dependent clauses. A dependent clause cannot stand alone as a sentence. Examples. The doctor, who is off on Thursdays, sees allergy patients in the morning. An adjective clause. Patients are sometimes quite apprehensive when they come to the office for diagnostic examination. An adverb clause. Physicians require that patients receive proper instructions for diagnostic procedures. Noun clause. A compound complex sentence contains 2 or more independent clauses, plus 1 or more dependent clauses. Example. Medical assistants should seek continuing education because medical technology is constantly changing, and the medical assistant must keep current with new procedures. Punctuation marks. In order to make sentences easier to read, and to tell a reader when you come to the end of a thought, a variety of markings called punctuation are used. The most common are the comma, period, apostrophe, hyphen, and ellipsis. The following information describes the correct usage of these marks. A period is placed at the end of each sentence. A comma or period should appear in front of an ending quotation mark. That is, or. There are 4 general rules for the use of a comma. 1 used between main clauses connected by and but, so, for, or nor, and yet. If main clauses are short, no comma is needed. 2. Use following long introductory phrases or clauses that may begin with words such as after, whenever, if, until, since, and once. 3. Used to separate items in a series. 4. Used to set off non-restrictive modifiers. A non-restrictive phrase or clause is a non-essential phrase or clause. It just adds descriptive or explanatory detail. A restrictive modifier restricts or limits the noun it modifies. Example. The medical assistant, being dedicated to her profession, helps the doctor in countless ways. The medical assistant, who is a part of the medical team, needs to be especially careful in attending to details. An apostrophe is used in contractions to signify that 1 or more letters have been left out. Be sure if you use it is that you mean it is. Who is, meaning who is, should not be confused with whose, and there is, meaning there is not to be confused with theirs. An apostrophe is also used to signify possession in a noun. Example: the medical assistant's pen, pencil, and notepad are always beside the office telephone. The assistant's stethoscope hangs in the examination room. Carefully check all hyphens at the end of a line to be sure the word is divided correctly. Check your dictionary if you are in doubt about the end of a syllable. 2 forms of ellipses may be used, 3 and 4 dots. The 3-dot ellipsis is used with spaces at each end, and between the dots, to signify an omission of words. Example: they come in 2 varieties, the 3-dot variety and the 4-dot variety. The 4-dot ellipsis signifies an omission of words and the end of a sentence with no space between the last letter and the first dot. Example: the 4-dot. Use a semicolon between 2 clauses of a compound sentence when they are not joined by a conjunction, unless they are very short and are used informally. Samples of conjunctions are therefore, however, nevertheless, the semicolon can also be used for clarity. A colon is used to formally introduce a word, a list, a statement or question, a series of statements, or a long quotation. It is used after the salutation of a business letter and between numbers denoting time. Quotation marks are used to enclose a direct quote. They are also used with titles of articles, chapters of books, and titles of short poems and stories. Spoken words and written narrative are also placed in quotes. A question mark or an exclamation mark is placed inside the quotation marks if it is a part of the quotation, outside if it applies to the main clause. Question marks are placed after every direct question. The exclamation mark is used after words, expressions, or sentences to show strong feeling. Parenthesis may be used to enclose matter apart from the main thought. Even though it contains a complete sentence, it does not have to start with a capital or end with a period. However, if it is an interrogative statement meaning question, it ends with a question mark. Capitalization. Capitalize names of persons and places, the first word in a sentence, names of holidays, principal words and titles of major works, and any product or title that might be trademarked. Many medical terms begin with a capital letter because they are names of the physicians who named them. Medications are usually trademarked. Again, use your dictionary when in doubt. Be especially careful to check every word in a heading or title for correct spelling. Use your medical dictionary or a good general dictionary. Always have these reference books in the office. Numbers. The use of numbers must be consistent. If you follow a specific reference style book, for example, the Chicago Manual of Style, Council of Biology Editor's Style Manual, American Medical Association Manual of Style, you should follow its instructions for using numerals or spelling out the numbers. Also, follow the rules your employer wishes to be used for your office. In the absence of other references and if the physician's preference is unknown, usually any number under 100 is spelled out, while those above are used in numeric form. A partially contradicting general rule says to spell out the number if it can be done in 1 or 2 words. A number at the beginning of a sentence must be spelled out. A person's age and the time of day is also usually written out. Dates, street numbers, and page numbers are written in figures. When several numbers are mentioned within a short space, figures should be used for all of them. Composing a business letter. With all the previous information, you are now ready to compose a business letter. There are certain steps in the process to consider to produce a final copy without errors. Phase and determine what information needs to be included. A. To answer a letter. B. To respond to a verbal request. C. To request information. D. To obtain a specific response. And determine the style for the letter and set margins and tabs for appropriate spacing on the page. If using a computer or word processor, select the type font if appropriate. Type a rough draft using concise, easy-to-understand sentences. Use the words I and we as infrequently as possible, especially to begin sentences. Remember, it is awkward to use the same word twice in one sentence, or even in 2 consecutive sentences. The use of a thesaurus to increase the usage of different words makes the content more interesting. Proofread the draft and make changes. Eliminate redundant, extra, unnecessary phrases. Type the final copy and sign it or give it to the sender to sign. In a specialist's office, one of the most common letters received that will require a response is a request from another physician for a consultation of a patient, figure 619. Before a response can be sent, the patient must be seen. You will often find it necessary to correspond with the patient if you need to send any special instructions, directions to your office, or other information. Be certain the material has ample time to arrive at the patient's home before they are due in for their examination. The reason for the appointment, the date and time of the appointment. It should request notification if the appointment cannot be kept. A statement saying that if there are any questions, please feel free to call your office. Be sure to include your office's phone number. The office visit will require a follow-up letter from your employer to the referring physician, identifying the findings, diagnosis, and recommended course of treatment. Mailable standards. All communications leaving your office should meet the standards for a mailable letter. These include, if typewritten, use clean, crisp type and a well-inked ribbon. No smudges should appear on the paper. Attractive letter placement on page, Figure 6-20 Part A. All parts and enclosures of the letter are included. The right margin is fairly even. Other margins are generous. Punctuation and spacing that follows acceptable business practice. If typewritten, no errors or strikeovers should show. Divided words at end of line are done correctly. Letter content is accurate as dictated. No spelling errors. Selecting a letter style. Letter styles vary in the location of some of the parts. Compare figures 620, B, C, and D. They are samples of the full block letter, the modified block letter, and the modified block letter with indented paragraphs. Notice the different placement of the parts of the letter with each style. Your employer may have a preference, so be sure you know which one is to be used. In full block style, the date line, address, salutation, body of letter, complimentary close, typed signature, and initials of typist are flush with the left margin. This is a popular style because no tab stops are needed. The most popular style is the modified block with the date line, complimentary close, and typed signature beginning a bit right of center. This style is compatible with most letterheads. The date line sets the style. If you place the date at the right, you must follow with a modified block style, lining up the complimentary close and typed signature with the date. The least popular of the three styles customarily used in the medical office is the modified block with indented paragraphs. The type and quality of stationery is a statement about the physician's office. If it becomes your responsibility to select the stationery, be sure to inspect any anticipated choice carefully. The letterhead is usually the choice of the physician. Letterhead stationery and matching envelopes are usually 16, 20, or 24-pound weight. The larger the number, the heavier the paper. It is usually ordered by the ream, which consists of 500 sheets of paper. Continuation pages are plain bond and should match the weight of the letterhead. A watermark appears on bond paper and should read across the paper in the same direction as the typing. You can determine the correct watermark side by holding the paper to the light. If you type on the wrong side of erasable paper, you will lose the erasable quality. Be certain to make a copy of every business letter or report to be sent from the office. Copies of correspondence regarding patients need to be filed in the patient's chart. Correspondence in answer to business letters needs to be copied and placed in the appropriate file. If your office still uses carbon paper for copies of correspondence, be sure the copies are also corrected whenever corrections are made on the original. A letter can be typed from dictated notes, from a dictation machine tape, or composed by you at the keyboard. Refer to Chapter 4, Unit 3. Certain formatting standards result in a mailable letter. The following are points to remember as you perform. Procedure 6.8. Type a business letter. The date typed indicates when the content of the letter was dictated. The month is spelled out in full. Traditional style is month, day, year. Military style is day, month, year. The inside address should be copied exactly from the correspondence to be answered, or as printed in the phone book or medical society directory. A courtesy title is used, Mr., Mrs., Miss, or Ms. If gender unknown, use Mr. Do not use doctor before the physician's name if MD follows. If a street address and box number are given, use the box number. The words north, south, east, and west preceding street names and road, street, avenue, and boulevard are not abbreviated. The words apartment and suite are typed on the same line as the address and are separated by a comma. Apartment may be abbreviated if the line is long. The name of the city is spelled out and is separated from the state by a comma. The state name can be spelled out or abbreviated. See Unit 4 for a list of abbreviations, and is separated from the zip code by one space. There is no punctuation between the state and the zip code. A proper salutation is Dear followed by the person's last name. If the correspondence is to a colleague or friend, a first name is appropriate. Ask the physician. When writing to a business, use gentleman, dear sir, or dear madam. To use a reference line, type RE, then the patient's full name. This line goes 2 spaces below the salutation, flush with the left margin in block style. It may be lined up with the date and follow the address in the modified block style. This is a common error because the dictator usually names the person before the salutation. Always double space between paragraphs, flush left with block style, and indented 5 spaces with modified block. If a second page is necessary, stop the first page at the end of a paragraph, if possible. If not, type at least 2 lines from the paragraph at the bottom of the first page. The bottom margin must measure at least 1 inch. The last word on a page cannot be divided. Always proofread the typewritten page. Before removing the paper from the typewriter so that corrections can be made more easily, refer to Procedure 6.8, make corrections on typewritten copy. If word processed or computer generated, print the copy and proof it. Proofing on screen is difficult because you cannot view the total letter at one time. Make corrections on the stored copy and print. Capitalize only the first word of a complimentary closing. Follow with a comma. The formality of the letter determines the closing. Cordially or sincerely is considered informal, while very truly yours is more formal. The sender's name is typed 4 spaces below the closing, exactly as on the letterhead. An official title follows on the same line, separated by a comma, or it can be typed on the next line with no comma. The typist's initials, in lowercase, are placed 2 spaces below the sender's name. When the sender will not be signing the letter, both the dictator's, in uppercase, and the typist's initials are used. Typists do not use their reference initials on letters they sign. When items will be enclosed with the letter, type enclosure or enc 1 or 2 lines below reference initials. Number and identify if more than one enclosure is included. If copies are sent to others, type CC for carbon copy, and the other receiver's name 1 or 2 spaces below initials or last notation. When more than one individual is carbon copied, list their names alphabetically or by rank. When a copy is sent to another person without the knowledge of the recipient, it is known as a blind copy. No notation is placed on the recipient's letter, but BEC is placed on the file copy to denote it was sent. A postscript, PS, is typed 2 spaces below the last notation. When using a second page, a heading of the patient's name, page number, and date is typed either vertically or horizontally, 1 inch from the top. If the letter does not concern a patient, the receiver is listed. The letter continues on the 3rd line after the heading. The page should contain at least 2 lines of a paragraph, proofreading. All written communication must be proofread before it is sent. This is a process of carefully reading printed material and marking errors for correction. There are certain problem areas to watch, such as 1. Words ending in S. 2. Apostrophes. 3. Combinations of punctuation. 4. Period. 5. Commas. 6. Double letters in words. 7. Capital letters. 8. 2-letter words. 9. Hyphens. 10. Numbers. And 11. Dashes. Proofreading requires concentration and attention to detail in a step-by-step process. Career proofreaders use at least a 3-read system. First, they read through the material to make sure it makes sense and to check for errors in composition, such as a misaligned margin, paragraph indents, spacing on the page, etc. Then they read for content, to make certain correct words, punctuation, and grammar are used. And last, a check of spelling. Because we can be fooled by what we think we see when we read normally, spelling is checked by reading the content backwards, checking each word, 1 word at a time. Going through these steps should ensure error-free communication. If possible, as a final precaution, have someone else critique the letter. When you proofread a draft copy, you should use standard proofreader's marks to indicate changes that need to be made. Knowledge of these marks is very helpful if your employer writes for professional journals or other publications, since materials that are submitted may be returned by the publisher with these markings and any other clarifications or charges they may desire. The final draft, called a galley proofs, will require very careful proofreading for any remaining errors before the material goes to print. The most common marks are shown in Figure 621. Developing good transcription and typing skills and the ability to produce error-free communications are very desirable traits. It can make you a real asset to the physician's practice. If you enjoy this type of work, it will probably be possible for you to specialize in communication preparation. Complete. Chapter 6, Unit 3. In the workbook, to help you meet the objectives at the beginning of this unit, and therefore achieve competency in this subject matter. Unit 4, Receiving and Sending Office Communications. Objectives. Upon completion of the unit, meet the following terminal performance objectives by verifying knowledge of the facts and principles presented through oral and written communication at a level deemed competent. 1. Sort, open, and annotate incoming mail. Answer. Sort the incoming mail by priority and by recipient. Open all mail that is not marked personal or confidential. Annotate the mail by stamping the date received, noting enclosures, and writing brief comments on the correspondence for the physician or office manager to review. 2. Describe how vacation mail might be handled. Answer. Vacation mail might be held by the post office until the office reopens, forwarded to a temporary address, or opened. And important items handled by a designated staff member. The physician should decide which method is used and leave written instructions. 3. Identify postal services that an office may require. Answer. Postal services that an office may require include first-class mail, express mail service, certified mail, registered mail, certificate of mailing, metered mail, and post office box service. 4. List points to remember in processing metered mail. Answer. Points to remember in processing metered mail are: first, check that the date on the meter is correct. Second, make sure the postage amount is correct for the weight and class of mail. Third, seal all envelopes securely. Fourth, place mail in the proper outgoing mail tray before the posted pickup time. 5. List 8 classifications of mail. Answer. 8 classifications of mail are first-class mail, second-class mail, third-class mail, fourth-class mail, express mail service, registered mail, certified mail, and certificate of mailing. 6. List 3 examples of first-class mail. Answer. 3 examples of first-class mail are personal letters, business correspondence, and bills. 7. List an example of second-class mail. Answer. An example of second-class mail is a newspaper or a magazine published at regular intervals. 8. List 4 examples of third-class mail. Answer. 4 examples of third-class mail are advertising circulars, catalogs, printed matter, and merchandise weighing less than 16 ounces. 9. List 4 examples of fourth-class mail. Answer. 4 examples of fourth-class mail are books, catalogs weighing more than 1 pound, parcels weighing 1 pound or more, and special fourth-class mail for educational materials. 10. Describe at least 4 of the specifications of express mail service. Answer. 4 specifications of express mail service are: first, it provides next-day delivery to most locations. Second, it includes insurance coverage up to $100. Third, it provides a receipt and tracking service. Fourth, it guarantees delivery by a specified time or postage is refunded. 11. Describe 2 reasons to use a certificate of mailing. Answer. 2 reasons to use a certificate of mailing are to prove that an item was mailed on a specific date and to provide evidence of mailing when no record of receipt is needed. 12. Explain why you might use certified mail. Answer. You might use certified mail to send important documents that require a record of mailing and a record of delivery, because the post office provides a receipt to the sender and obtains a delivery record. 13. Describe the purpose of the use of registered mail. Answer. The purpose for use of registered mail is to provide maximum security for valuable or irreplaceable items, because it includes insurance, tracking, and a chain of custody record from mailing to delivery. 14. Name 6 means of communication other than by mail. Answer. 6 means of communication other than by mail are telephone, facsimile, teleconference, electronic mail, courier service, and personal delivery. 15. Name 6 uses for a fax machine. Answer. 6 uses for a fax machine are: first, transmit prescriptions to a pharmacy. Second, send medical reports to a consulting physician. Third, receive laboratory results quickly. Fourth, send insurance forms to carriers. Fifth, transmit patient referral information. Sixth, send business correspondence immediately. 16. Spell and define, using the glossary at the back of the text, all the words to know in this unit. Answer. Foreign abbreviations. Shortened forms of words from other languages. Guarantees. Formal promises that certain conditions will be fulfilled. Annotating, adding notes or comments to a document. Judgment. The ability to make considered decisions, also a legal decision by a court. Cancellation. The act of making something no longer valid by marking or destroying it. Polling. The process of questioning or canvassing people to collect information, certified, officially recognized as true or accurate. Mail for which the sender receives proof of mailing and delivery. Postmark. An official postal marking stamped on mail showing the place and date of mailing. Confirmation. Proof that something is true or has happened. Priority. The fact or condition of being regarded as more important than others. Consecutively. Following one after another in order without interruption. Recipient. A person who receives something. Domestic. Relating to the home or to one's own country. Teleconference. A conference with participants in different locations linked by telecommunications. Envelope. A flat paper container used to enclose a letter or document. Thermally, relating to heat or temperature. Facsimile. An exact copy of written or printed material transmitted electronically. Abbreviated as fax. Transmitted. Sent from one person or place to another. Incoming mail. The volume of mail to the physician's office depends on the number of physicians. In smaller offices, the task is manageable, but in large clinics, it may be necessary to have a mail clerk who is responsible for sorting and delivering the mail within the clinic. The office policy manual should give instructions regarding the handling of mail. If no manual is available, the office manager or the physician should be consulted. The following are some generally accepted practices. Sorting mail. Incoming mail should first be sorted. Any mail marked personal should be placed on the physician's desk unopened. Special delivery mail, mailgrams, or special messenger mail should be opened immediately. The mailgram is a postal service offered jointly by the USPS and Western Union. Mailgrams are transmitted over Western Union's communication network to printers located in over 140 post offices, then placed in special envelopes carrying the Postal Service emblem and delivered the next day by regular carrier. First-class mail may consist of special delivery mail, mailgrams, special messenger mail, correspondence from patients, payments from insurance companies, insurance forms to be completed, general correspondence, and various reports. Referral letters or reports from physicians. B. Laboratory reports. C. Hospital reports. D. Professional organization mail. And miscellaneous mail. Second, third, and fourth-class mail consists of professional journals, magazines, newspapers, advertisements, promotional literature, and samples from pharmaceutical companies. First-class mail may be sorted into mail from patients, from physicians, from insurance companies, and miscellaneous. Other classes of mail, such as magazines, professional journals, and newspapers, should be separated from drug samples and advertisements. Opening mail. When opening mail, you will need a letter opener, paper clips, a stapler, and a date stamp. It is more efficient to stack all envelopes so that they are facing in the same direction. A quick tap on the desk will move contents away from the flap side of the envelope. Open all letters along the flap edge, being careful to remove all contents from each envelope. As the mail is removed, be sure the contents contain the same name and return address shown on the envelope. Some offices want you to keep the envelope with the mail received, and certainly you should if it is needed to help identify the contents. Otherwise, you may discard the envelopes. Date stamp the correspondence and attach any enclosures. If an enclosure is indicated on the letter but is missing, it is necessary to write none after the incla notation and circle it to indicate the need for follow-up. Processing incoming mail. Exercise your best judgment to determine which mail can be handled without the aid of the physician. This type of mail would include routine office expense bills, insurance forms, and checks for deposit. If cash is received in the mail, you should always seek a witness to verify the amount of money and have that person sign a receipt along with you to be sent to the patient. This helps avoid the possibility of the patient saying that more was sent than was actually found in the envelope. This can happen quite innocently with elderly patients who may have a poor memory. If you are employed by a surgeon, the mail will contain copies of hospital summaries and operative notes. These can be filed directly in the patient's chart. Often copies are sent to the referring physician. Other hospital, laboratory, or special examination reports received should be seen by the physician and initialed before they are filed. Requests regarding patients or other office matters should be placed in a designated area for the physician to see and respond to each day. The medical assistant can perform a valuable time-saving service for the physician by annotating the incoming mail or identifying important points to be noticed. If any correspondence or a patient chart will be needed to answer mail, it should be pulled and placed with the mail to be answered. Notifications of meetings, miscellaneous correspondence, and professional journals are placed under the stack of mail. Some physicians want to see all supply catalogs and pharmaceutical company descriptions of products. In other offices, many of these items are disposed of immediately, especially if they concern areas of practice the office does not provide. Items that may be needed for future reference should be placed in a designated file. Drug samples that may be used should be placed in a designated area for future use. Samples that will not be used should never be placed in the trash, where they could cause harm to individuals taking them without medical evaluation and advice. Often, community clinics and service organizations can make good, safe use of unwanted samples. The office should have a box to collect samples for this purpose.
When the physician is away from the office for professional meetings or on vacation, the medical assistant may be asked to carefully read all mail and decide how each piece will be handled. You should discuss what to do with urgent mail before the physician leaves. The physician may want you to call to discuss, or in some cases to copy and forward the mail. Never send the original. If the physician will be away for a long time, you may need to send urgent mail more than once. If so, be sure to number the envelopes consecutively and keep track of what you send so that you can be sure all the urgent mail is received. When responding, you may also wish to send a brief note explaining the reason for the delay in answering. If the office will be closed temporarily or permanently, be sure to go to the post office and complete a form to have mail held or forwarded to another address. Never send this form by mail as it may be delayed. The USPS cannot take verbal orders for this purpose. Allowing mail to accumulate invites theft.
The United States Postal Service, USPS, uses optical character readers, OCRs, and barcode sorters, BCSs, to read the addresses on envelopes you mail. The BCS equipment is capable of sorting over 30,000 pieces of mail per hour, but only if envelopes are properly addressed. The barcode is a series of little lines you often see at the bottom of letters from utility companies, banks, retailers, and other businesses, Figure 622. Each piece of mail passes by the computer's scanner for a quick read of the delivery address. Then, it goes to the OCR's printer, which sprays on a barcode representing the zip code or zip+4 code for the address. Next, the mail piece goes to one of the OCR's sorting channels reserved for the proper delivery area. From there, the barcoded mail is fed to BCSs for the final separations. The BCS processes mail just as quickly and in much the same way as the OCR reads addresses, except its scanner recognizes only one thing: the barcode. As the barcode on your mail piece passes the BCS lens, it is quickly read and sent to the appropriate channel for delivery. Addresses should be typewritten or machine printed to be processed on automated equipment. Script or executive type should not be used. The USPS prefers that the entire address be printed in uppercase letters and, except for the hyphen in the zip+4 code, all punctuation should be omitted. Lines of the address should be formatted with a uniform left margin. The shaded area in Figure 623 illustrates the area on the face of the mail piece where address information should be located to be read by the OCRs. The OCRs and BCSs register mail pieces on the bottom edge. Therefore, all vertical measurements are relative to the bottom edge. Where possible, the entire address, exclusive of the optical lines above the name of the recipient line, should be contained in an imaginary rectangle which extends from 3/8 to 2, from the bottom of the mail piece, with 1 margins on each side. At a minimum, all characters of the last line of the address block the post office, city, state, and zip code or zip+4, should be located within an imaginary rectangle, which extends from 3/8 to 2¼ from the bottom of the mail piece with 1 margins on each side. Care must be taken to make the lines straight, as slanted lines cannot be read by the OCR process. The only abbreviations permitted in the name of the city are those found in the Abbreviations section of the National Zip Code Directory. The OCR cannot read a non-standard abbreviation. Special notations for the post office, such as special delivery or certified mail, should be typed in all capitals 2 lines below the postage. Be sure you are above the address zone. Special notations for the recipient, such as personal or confidential, should be typed in all capitals aligned with and 2 lines below the return address. The zip code is critical to the rapid delivery of mail. The first number of the zip code refers to a region of the United States, from 0 for the East Coast to 9 for the West Coast, and Hawaii. The next 2 numbers refer to the major post office in the region, and the final 2 identify the local delivery post offices. The newer zip+4 coding will allow even better use of automated processing in that the first 2 additional numbers denote a delivery sector, which may be several blocks, a group of streets, several office buildings, or other small geographic area. The last 2 numbers denote a delivery segment, which might be 1 floor of an office building, 1 side of a street, specific departments in a firm, or a group of post office boxes. If your office has a large volume of mail, the use of zip+4 offers a discount in postal rates. The USPS will offer assistance in converting to zip+4, but the confidential nature of medical office records means that patient interests would best be served by converting your own records. The customer service representative at the post office can answer your questions on the use of the ZIP+4 National State Directory. Now that you know how to address an envelope correctly, it is time to put the pieces together. The name of the intended recipient, business or individual, should appear on the first line. The line above the name of the recipient is an optional line for additional address information. When needed, it should be used to direct mail to the attention of a specific person when a business name has been placed on the name of the recipient line, or to provide other information that will facilitate delivery, i.e., the name of a department within a company. The line immediately below the recipient line is designated the delivery address line. The street address, post office box number, rural route number and box number, or highway contract number and box number should appear on this line. Mail addressed to multi-unit buildings should include the apartment number, suite, room, or other unit designation immediately after the street address of the building on the same line. When the length of the delivery address is such that it prevents the placement of the unit number or other designation on the same line, the number or designator should be placed on the line immediately above the delivery address line. When the use of the building name in the address is necessary, it should also be placed on the line above the delivery address line, figure 624. For domestic mail, the post office, city, state, and zip code or ZIP+4 should appear in that order on the bottom line of the address. However, if all three elements do not fit on that line, the zip code or ZIP+4 may be placed on the line immediately below the post office and state, aligned with the left edge of the address block. The standard two-letter state abbreviations should also be used. Figure 625. The ZIP+4 codes should always be printed as 5 digits, a hyphen, and 4 digits. The hyphen should be treated as any other character as far as spacing and stroke width are concerned. Mail addressed to Canada may use either of the following formats when the postal delivery zone number is included in the address. Mrs. Helen Saunders, 1010. Clear Street, Ottawa, Ontario, Canada, K1A0B1. The post office will furnish additional information on mailing to foreign countries if assistance is needed. Completing mailing. When you are satisfied that your letter and envelope are complete, place the flap of the envelope over the top of the letter and secure it with a paper clip. If enclosures are indicated, be sure these are included. It is a good idea to have a signature folder in which finished mail is placed. When the mail has been signed, fold it and place it in the envelope. A standard-sized letter should be folded by bringing the lower third of the letter up and making a crease, then folding the top third of the letter down to about ½ an inch from the creased edge and making a second crease. The second crease goes into the envelope first. To fold a standard-sized letter for a 6 3/4 envelope, bring the bottom edge to within ½ an inch of the top edge and crease. Fold from the right side, about 1/3 the width of the sheet, and crease. Fold from the left edge to within ½ an inch of the second crease. Insert the left edge crease into the envelope first. If you have a large number of envelopes to seal, you can speed up the process by placing 8 or 10 envelopes, addressed side down with flaps open in a fan fashion. Use a damp sponge to wet all the flaps at once, and then starting with the lower letter, turn down each flap and seal. Be sure that the sponge is not too wet, as it will wet the envelopes and may spread glue so that letters stick together before you can seal them. Stamp or meter mail. The cost of sending mail is an expenditure that must be examined to be sure you obtain the most for your money. Your local post office can furnish you with current information. Postage rates, categories, and regulations are changeable, so you need to be current. Mail may be either stamped or metered. Stamps may be purchased at a post office or obtained through the mail by using a specially printed envelope available through the post office. If you have a large volume of mail, it is preferable to use a postage meter. This machine can be leased from several authorized dealers, but the license to use it must be obtained from the USPS. A medical office can obtain a license by submitting an application to the post office where the metered mail will be deposited. Postage meters contain a sealed unit that houses the printing die and 2 recording counters. One counter adds up all the postage printed by the meter. The other counter subtracts and shows the balance of postage remaining in the meter. When you purchase an amount of postage, the post office will open the meter with a key, set the counter for the amount of postage purchased, and relock the meter. When the prepaid amount runs out, the meter will lock automatically. The postage meter prints prepaid postage either directly on the mail or on adhesive strips that are then affixed to the mail. The metered mail imprint, or metered stamp, serves as a postage payment, postmark, and cancellation mark. All mail classes, amounts of postage, and quantities of mail may be metered. Metered mail, when bundled, can provide faster service than stamped mail because it is already postmarked and will bypass postal cancellation equipment. To expedite the processing of metered mail, remember to 1. Change the date on the meter daily. 2. Apply the correct amount of postage by weighing the mail before affixing postage. 3. Check the imprint to be sure it is clear and readable. And 4. Use fluorescent ink in the meter, figure 626. Mail is classified according to type, weight, and destination. First-class mail includes handwritten and typewritten messages, payments from patients or insurance companies, laboratory reports, and any other business mail that weighs up to 11 ounces. Postage is figured by the ounce. All first-class mail over 11 ounces is considered priority mail. The cost of priority mail is determined by the weight and zone of destination. The maximum weight for priority mail is 70 pounds. If you need to send first-class mail that is larger than the usual number 10 business envelope, the envelope should have a green diamond border which signals the post office that the letter is to go first class. The office should have a mail scale so that you can determine the amount of postage necessary for your mail. The second ounce does not cost as much as the first. Second-class mail includes newspapers and other periodicals issued regularly, at least 4 times a year. You are not likely to use this classification unless you work for a medical society that mails its own journal. Third-class mail includes circulars, printed booklets, catalogs, newsletters, and merchandise weighing up to, but not including 16 ounces, which is not required to be mailed at first-class rates or as priority mail. Anything 16 ounces or more must be mailed fourth-class or priority mail. Fourth-class mail is commonly known as parcel post. The classification also includes bound printed matter, books, 16mm or narrower films, sound recordings, and manuscripts. Fourth-class postage is computed by weight and the zone of destination. In combination mailing, a first-class letter is sent with a parcel, either by placing the letter in an envelope and attaching it to the outside of the package, or by enclosing it within the parcel, in which case you write letter enclosed just below the postage. This method is used frequently in the field of medicine for sending X-rays with an accompanying report. Separate postage is paid for the 2 items. Express mail service is a reliable, speedy delivery service available in most major metropolitan areas for anything mailable up to 70 pounds and 108 inches in combined length and girth. You are given a receipt when the letter or package is mailed, and the addressee is required to sign a confirmation of delivery. Each express shipment is insured against loss or damage at no additional charge. Postage varies according to weight and the type of express mail service chosen. A form with a large A or B on it will be attached to express mail. It designates post office to post office service. Mail which is deposited by 5:00 p.m. at an express post office will be shipped to the destination post office for customer pickup the next day as early as 10:00 a.m. B designates post office to addressee service. Mail which is deposited by 5 p.m. at a designated post office will be delivered to the addressee no later than 3:00 p.m. the next day, weekends and holidays included. A full refund of postage will be made if shipments are delivered later than the service standard called for. You apply at the originating post office for the refund. Express mail envelopes and labels are available at the post office, as well as a network directory of all destinations that can be accessed. Special delivery may be purchased for all classes of mail to provide prompt delivery to the destination post office. Smaller post offices and rural routes do not offer this service, so it is best to check before mailing a letter to such an address. Do not send special delivery to a box number because it is considered delivered when it is put in the box. A certificate of mailing provides evidence of mailing. The postal clerk will date and initial the slip you prepare to show that a piece of mail was sent from that post office on a particular date. The service is inexpensive and is often used as evidence that a document was mailed or a deadline was met. For an additional fee, certified mail provides an opportunity to restrict delivery to the addressee only and to request a signed return receipt. This method of mailing should always be used when you need to be certain a patient, and only the patient, receives specific communication. It could be a sensitive lab report, a copy of a consult, an important physical examination report, or anything that is highly personal or contains important information. It is also appropriate to use certified mail to notify a patient that because instructions and treatments are not being followed as ordered, medical services will no longer be provided, and that another physician should be contacted. A certified letter ensures you have verification that the patient received notice. The signed return receipt needs to be filed in the patient's chart as proof that the patient received the letter. Registered mail is the best method to use if sending valuable articles.
Paying the extra fee for this service guarantees extra security in the form of locked mail bags and signed releases for each step through which the mail passes. The full value of the mailing must be declared, and it can be insured up to $10,000. Only first class and priority mail can be registered. You can insure any class of mail against loss or damage. You can also request a return receipt and restrict the delivery. If you have deposited mail and find you want it back, you will need to file a written application at the local post office, with an envelope addressed exactly as the one you wish returned. If the post office finds that the letter has left the local post office, the postmaster will telephone or telegraph the destination post office at your expense to have the letter returned to you. If you have mail returned because the patient has moved and left no forwarding address, you can try contacting the employer for a new address or talking with the individual who referred the patient. When a letter is returned, after an attempt has been made to deliver it, you must prepare a new envelope and put on new postage before remailing. This sometimes happens if you have made an error, such as transposing numbers in an address. Alternative ways to communicate. There are many ways to receive and send information in today's technological society. Some common methods are fax, pager, cellular phone, voicemail, conference call, teleconferencing, email, and the internet. Fax machines, facsimile, fax machines, figure 6 to 27, can be used by hospitals, physicians' offices, and clinics to send and receive patient information over telephone lines. The machine makes it possible to send and receive letters, medical reports, laboratory reports, and insurance claims. Physicians may use the fax machine to send prescription orders to pharmacies. The office may also use it for ordering office or medical supplies. A fax machine is connected to a telephone line. The machine scans a document and converts the image to electronic impulses that are transmitted over the telephone lines. The receiving fax machine converts the impulse to make an identical copy of the original. Fax machines may print on thermally treated paper or plain paper. The thermally treated paper fades when exposed to sunlight. Therefore, you would usually photocopy an important document onto bond paper. The fax machine is available with many special features. Certainly a concern in the medical office is the transmission of confidential material. It is possible to have a secret code that will lock out unauthorized polling. The fax machine may also be able to store multiple documents in memory and have automatic dialing with redialing when a busy signal is detected. The paper is automatically cut to the length of each page of the received message. If the recording paper runs out, the message is stored in memory and will be automatically printed out when new paper is loaded. A battery safeguards the document memory in case of a power failure. The machine may be equipped with a white line skip function that automatically skips over horizontal blank spaces on a document. This feature allows a standard document to be transmitted in as little as 12 seconds. You will need to learn the specific procedure for operating the fax machine you will be using. However, there are general rules that are important for using any fax machine. 1. Always remove paper clips and staples from the material to be scanned so you will not damage the fax machine. 2. Make a test copy if the document has color. Dark colors may block copy and can slow transmission. 3. Do not use correction tape or fluid on documents to be transmitted. 4. Do consider typing words for numbers to avoid problems with interpretation. 5. If the material you are faxing is confidential, before sending, call the recipient to alert them to be watching for the material. 6. The first sheet of any transmission is called the fax page. It includes the date, name of recipient, recipient's address and fax number, and the number of pages being sent, including the fax page. The name and fax number of the sender will also be included. Any other special information required for routing instructions should be added. 7. Be familiar with the error messages the fax machine may display and learn how to correct these problems. The machine may be equipped with built-in service diagnostic codes that can be automatically transmitted over the telephone lines to a service provider. Most service calls can be resolved by telephone, which therefore reduces costly equipment downtime and labor costs. 8. You may need to resend a message if noise or interference on the telephone line resulted in an unclear transmission. 9. Check to be sure the transmission is completed before you leave. It will indicate the message was sent, identifying the date and time of transmission. Remove the original from the machine. Pagers physicians commonly wear pagers, so they can be contacted regardless of where they are or what they are involved in. A pager is a small electronic device that is activated by a telephone signal. When you wish to contact the physician, you simply dial the number. After it rings, a series of beeps will be heard, and you then enter the phone number from which you are calling. Meanwhile,
The beeper being worn by the physician will be activated and will produce a beeping sound or, if sound is turned off, will vibrate to alert the wearer of a call. The phone number of the caller will be displayed in the small viewing area, and the physician can go to a phone and make the call. Some newer models have the viewing capacity and ability to receive small messages that print out on the pager's viewing area. An additional feature provided by some paging services allows voice messages to be left, which can be retrieved by the receiver from any phone. Pagers are very beneficial and allow people to stay in contact even when they are not near a phone. Voicemail is another way to communicate. It is similar to a telephone answering machine, except it can receive messages into your mailbox, even if your phone is busy. Basically, if you call and the individual is either not there to answer or is talking on the line, a recording comes on. The message is usually spoken by the individual and typically changes daily. It may tell you the date and explain where the person may be. It may also give you the individual's schedule for the next couple of days. It will then typically request that you leave a message. When the individual checks their phone, an audible cue such as an intermittent dial tone alerts them to a message in their box, or the phone may be equipped with a message light. Another advantage of voicemail is that a sender, with the proper software, can record a message and then direct it to several mailboxes. This is especially helpful within a company or association to notify several people of an event or a meeting. These messages can also be retrieved from any phone by accessing the mailbox, using a personal identification number. Cellular phones. The ease and portability of cellular phones make them another option for communication. As the phone technology makes them smaller and lighter, they become a more easily carried device. Slim pocket-sized phones are now available with some slightly larger than a credit card. Of course, their greatest advantage is the familiarity of use and the ability to give and receive information instantly. Perhaps their only disadvantage may be the difficulty of reception within certain environments and within certain locations. The inconvenience of inappropriate times for ringing to occur can be solved for the most part by the adjustment of the ringer. Conference calls. The telephone can be used to simultaneously conduct conversations with several people in various locations at the same time. This allows business to be conducted, meetings to occur, and professional or personal communication to be carried out. Conference calling saves time, travel, and money, all important in managing practice expenses. If your phone system is not equipped to allow multiple connections, conference calls may be arranged with the local phone provider. Teleconferencing. This means of exchanging information is like a conference call, but everyone can see and hear each other at the same time. They are linked together by way of telecommunications equipment. There are cameras, speakerphones, connection devices, and television monitors in each of the locations. The phone company for the meeting originator will contact all other sites and network the phones together. With the aid of the phone, camera, and television, participants can see and talk to each other. A teleconference can involve several people in many different locations. Ideas can be presented, concerns expressed, and new techniques shown. It is the next best thing to actually being together in a meeting, yet it conserves travel time and expense. Telemedicine. In January 1997, the Harvard Health Letter reported an exciting long-distance medical care that is happening and may become more routine. It enables physicians to see patients at other sites miles away from their home base or office. It involves the use of electronic stethoscopes, digitized X-ray transmissions, and interactive video to examine, diagnose, and treat patients. In Kansas, nurses who make home visits to chronically ill patients began using interactive video to enable them to see more people. The home care agency set up a camera and a 13-inch TV in a participant's home. The nurse sends a buzzer, sound to alert the patient that the call will occur in 2 minutes. The patient sits in front of the camera and talks with the nurse as they perform a series of tasks using digital equipment attached to the TV. The electronic stethoscope is placed on the chest to check the heart. A blood pressure cuff gets a reading. A finger stick and the glucometer tests the blood sugar level. And the finger oximeter measures the amount of oxygen in the blood. Patients seem to like the approach, and it has greatly boosted efficiency. When driving from patient to patient, only 5 people could be seen in a day. Now they are able to see 3 times as many. Telemedicine enables primary care physicians to consult with a faraway specialist immediately, while the patient is still in their office. As an example, the cardiologist can listen to a patient's heart with the electronic stethoscope and assist the primary physician in diagnosing a murmur or irregularity. It has been adapted to permit house calls to people who find it physically difficult to visit care facilities
or for those who live or are stranded by weather in remote areas. Healthcare reform may encourage this form of practice as a more efficient use of resources, e.g., skilled specialists. A California pilot program links physicians at Stanford University with patients at a nursing home, an urban clinic, and a multi-specialty medical practice. This allows experts from the university to participate in the examination of high-risk or problem cases. Through the use of high-resolution computerized images, it is possible for the specialist to see a skin rash, a fetal ultrasound, or the retina of the eye. The capabilities are endless. In 1996, doctors at the New England Medical Center in Boston conducted about 1,500 consultations with regional and overseas patients, one as far away as South America. There are some issues to be settled regarding this form of medical practice. Items such as costs to initiate, legal, ethical, and professional concerns need to be addressed. Some physicians see it as threatening since they would have to compete with many more physicians than just those in their local area. And of course, there is the issue of malpractice liability. If the consult is out of state, whose state laws apply? Another factor is privacy when sending personal medical records through telecommunication systems. Congress recently passed legislation requiring federal health officials to develop specifications for a national computer network that will enable doctors, hospitals, insurers, and others to transfer patient records electronically. Now, a way to keep them confidential must be found. Another big question is medical licensure, since physicians are licensed only in the state where they practice. Currently, 10 states require that doctors who practice within their boundaries hold a state license, even if their presence is purely electronic. The AMA went on record recommending full licensure for each state except in emergencies and physician-to-physician consultation. Some states, however, feel a limited telemedicine credential would be sufficient. Some telemedicine physicians feel it is time for a national licensure to be established for physicians and solve the problem completely. This new form of medical practice will be interesting to watch develop. This form of communication, electronic mail, is carried out by a computer and appropriate software. Before you can send or receive messages, you need to have an email address. Email can be exchanged within a company or clinic, or outside to anyone with a phone and an address, which is obtained through electronic service providers. You are charged a fee for the amount of time you are using the network. It can be by the word or a flat rate. To communicate by email, you will need some form of communication software on your computer. To use it, you need to access the networking system and the connection with the provider of the service. When you wish to send a message, you contact the provider through your computer and modem. The provider's modem then receives the request and routes it to the electronic address you indicated within your message. Electronic addresses will contain the person's name or initials, perhaps a location, an employer or association, and the provider, but not necessarily in that order. An address will look something like this: John Smith at Chicago AMA Magnus ACS.com. When you receive communication, you can open your email and read the information. If you wish to save it, it can be printed or sent to your hard disk and stored. This communication link allows you access to information from all over the world. It can be a great source of data from health organizations such as the American Cancer Society and the Centers for Disease Control. Another capability through the internet, which your physician may wish you to use, is the ability to schedule airline, hotel, and other services directly without going through various agents. Again, to access the information, superhighway as it is called, you will need a computer, the appropriate software, and a modem. A service provider is required in order to allow you access to the various suppliers of information. If you learn how to identify what you are looking for, you probably can find it. All you have to do is give the provider's computer your subject matter. You enter the appropriate keywords into a search engine, such as Yahoo or AltaVista. In return, you receive a listing from which you can select a more specific entry. When this is viewed, it may be even further definable until you can pinpoint the topic you want. You can access a source's homepage to obtain their general information. By identifying your topic more specifically, you can bring the appropriate information to your screen to view. You can read it there, produce a hard copy with your printer, or store it on your disk. It is possible to enter, obtain, and exchange information as well as conduct business transactions, such as banking, all electronically. The amount of material available is mind-boggling. It is possible to look at books, museums, associations, publications, the world's encyclopedias, and on and on. However, there is some concern about the lack of security. With all the providers and information routing involved,
interception of information is possible. Because of this, and the nature of medical records, and the need to provide for the privacy of information, electronic communication may not be advisable in a medical office. This new technology will make for a great change in the way we access and exchange information in the future. At present, the storehouse of historical data is unbelievable. The ability to have instant connection with virtually every business, university, organization, and even government is apparently reasonable. You must learn to use new technologies. When things change and go on, you must go with them or be left behind, unable to compete in the new workplace. Complete Chapter 6, Unit 4 in the workbook to help you meet the objectives at the beginning of this unit and therefore achieve competency in this subject matter. Throughout this chapter, you should be mindful of all medical, legal, ethical implications. Listed below are a few important reminders. Use only blue or black ink for documenting messages. Draw a single line through an error, then initial, date. Keep the office policy handbook updated on a routine basis. Cover telephones adequately at all times. Chart reasons for all missed appointments. Establish and maintain good rapport with patients. Never give information over the telephone to anyone concerning a patient, unless written authorization from that patient is on file. Mr. Wright uses black ink when documenting information about patients. If an error is made, he draws a single line through it, initials and dates it, and then briefly states the error. He is polite in speaking to patients over the telephone and never leaves the telephone unattended. When a patient misses an appointment, he records the reason on the chart. He never gives information to anyone on the telephone or otherwise, unless written permission is obtained from the patient. When it comes time to revise the office policy handbook, he offers helpful suggestions. He is efficient in office correspondence and in scheduling appointments. Advancement potential, excellent. Miss Wrong never worries about what color she uses in recording patient information. She frequently uses whiteout or erases errors on the patient's records, schedule book, and other documents. She is short and rude with patients over the telephone when she does answer it. She has been known to put callers on hold for long periods, or even hang up on them. She is careless about taking messages and forgets to write them down. When a caller requests information about a patient, she tells the caller she'll get it if she can find it. She pays no attention to the office policy handbook because she thinks it is silly. She makes appointments when she remembers and is negligent in correspondence. Advancement potential, none.